Hello. Woo. We'll just get started and I'll give people a minute to sit. All right. Good afternoon and welcome. Welcome. I'm so pleased that you're here to kick off the Harvard Climate Action Week with all of us. You know, it's fitting. It really is fitting that this week begins with our symposium on climate, health, and equity, because our program today will lay out the stakes with absolute clarity. Climate change is not a distant, abstract concept or threat. Climate change is harming our health right here and right now. Climate change is deepening inequities right here and right now. And we all know that we have the tools to tackle climate change right here and right now. I really love the agenda for today's symposium. And I love the agenda because it brings together leaders from across disciplines and across sectors who are focused on bringing about solutions to the challenges of climate change. You're going to hear from global activists who are fighting to keep their communities healthy in the face of climate change. You're also going to hear from state and federal administrators who are using every tool at their disposal to advance environmental justice. And you will hear from Harvard scientists who are documenting the dangers of climate change and leading the charge to develop smart policies that can protect our people and our planet. Now, I think many of you know that the Harvard Chan School faculty are not new to this work. The Harvard Chan School faculty have been a leading voice for environmental health for decades. We've captured some of that work on a short video, and so I'll ask the team to play that clip for me.
If we think about actions to fight climate change as opportunities to invest in public health, we will make our world healthier and more just today, while we create a path towards a future we can be proud to handle to our children.
The Harvard T.H. Chan School of Public Health has a decades-long legacy of tackling the health impacts of climate change. From the landmark Six Cities study, which led to a tightening of U.S. air pollution standards in the 1990s, to the founding of Harvard Chan Sea Change in 2018, to recent work on climate justice.
The fundamental injustices in the global system are yet to be fully addressed in terms of who emits and also who bears the brunt. And the biggest emitters are not paying the price.
And the impact of climate change on the spread of infectious disease.
If we really want to prevent the emergence of diseases like coronavirus, we have to be thinking about how we deal with nature and how we deal with climate.
Our researchers continue to break new ground, communicate critical findings to everyone who can drive change, and inspire new generations of climate optimists.
The health community is a sleeping giant and we are waking up. We know what needs to be done and we are not going to rest until we have the optimal treatment we need for our patients and our communities.
An incredible piece. I hope you agree with me. Renee's words are ringing in my ears. She said, the health community is a sleeping giant and it is waking up. That's what today is all about. Everyone in this auditorium cares about health, justice, and equity. Everyone wants to build a more sustainable and resilient future. And so I hope you don't spend the next 5 hours simply listening. Use this convening to build connections and to forge collaborations. I hope you leave here knowing how you will make a difference right here and right now, because the world needs us to make that effort. With that, I'm proud to welcome my friend and my colleague, Dr. Kari Naidoo, to the stage. Kari. Kari is a pediatrician, a scientist, a passionate advocate for public health, and a clarion voice for climate justice. She's also, I'm very delighted to say, our newly appointed chair of environmental health, the department at our school, at the Chan School. Kari, I'm going to leave it all to you.
Thank you, Michelle. It's wonderful to see all of you here today. And thank you and welcome to everyone. I have just a few quick housekeeping notes. We will have several breaks throughout the day, and you'll find coffee, tea, and snacks right outside the auditorium. And importantly, if you're tweeting about the symposium, please use hashtag Harvard Climate Action Week. And we're really excited now to start the first panel. And I'd like to make sure that the panelists can come up and sit here. And we'll start with our first panel called Climate Change is Personal. Thank you. I'm delighted to introduce our panelists. Climate Change is Personal. We have brought together community leaders from around the world to talk about how climate is affecting their health and the health of their families, friends, and communities. Joining me are Shweta Narayan, thank you. And she is a global climate campaigner with the group Healthcare Without Harm and lives in southern India and came all the way from southern India to be with us today. Thank you. Thank you. And Carolina Reyes from Springfield, Massachusetts, as a community health worker there, coming in all the way from Springfield to be with us. Thank you so much, Carolina. Thank you. And finally, we are so glad that Pasi Amayo Ogula is here today to be able to be with us. She is a program manager with the Society of International Development who lives in Western Kenya.
Thank you.
Thanks. So the first question that I'd like to ask is, it's probably on everyone's mind as well, how is climate change affecting your health in your community? So I'll ask that to you first. And Shweta, if you don't mind going and answering
Thank you.
that.
I mean, absolutely, there's no doubt that our health and our community's health is getting affected. Personally, for me, I live in a small village in the Western Ghats of southern India. It's a hill community, and in the last 5 years, we've seen during the pandemic and even now that there's been a great change in the pattern of diseases that is being reported both at the veterinarian center in the village and at the public health center in the village. And that just goes on to tell that the changes in temperatures, the changes in, we've seen changes in temperatures, we've seen changes in the quantity of rainfall and the periods of rain. And I mean, earlier I used to live in a city and this didn't matter to us, but now living in a village and trying to grow vegetables and grow food and trying to be more connected to the land, every change in the pattern or every deviation from the pattern affects us in a much more deeper way than ever. Change in quality of food, the diseases, the period of infectious, and this is what when we were talking to the veterinarian locally, the periods of infectious diseases have increased, and to the point that the annual allocation of medicine in the hospitals is not enough. They run out of medicines in 6 months instead of like the whole year's quota. So we're seeing a great change in kind of diseases, in kinds of the way people are adapting locally. I also want to tell, I mean, in my work, I work with fence line communities, primarily living around coal mines and power plants and chemical industries. And the impact of industrial activity, mining, and climate change is sort of pushing marginalized communities further in the margins. And more than just the environmental contamination, the poor air quality and water, it's also the erosion of cultural identity. People relate to their rivers, to the forest, to the land, and unfortunately, all of that is getting destroyed to the point that communities, the social fabric of communities, are torn apart. So it's not just the disease and the changing patterns, but it's the impact on, as a society, as a community, that's hurting us.
Thank you so much. Really wise comments, and we appreciate that from your culture as well. Carolina, how does climate change
Hello,
affect your
everybody. Thank
community?
you for the opportunity to be here today. I want to say that I live in Springfield, and I work for Behavioral Health Network. And the impact that we've seen in our community is we have people that have migrated for other countries and towns due to the weather, hurricanes. We also have been impacted by a tornado, and we lost people's life. And we also been impacted by asthma, allergies, changes in people's way of living. We also have people that have migrated from other towns and other nearby towns, and also from farms, people that work in the farms, work in the land, and then the climate has affected the harvest, and they had to go to the city to get jobs because they don't have any more jobs. Not only the affecting the farm, but also the way we eat, and also our health, and also to see that we had to use more chemicals to grow our food in order for us to feed our people. And that is impacting our health pretty bad.
Thank you, Carolina. Pasi.
Thank you, Carrie. So hi, everybody. So I come from Kenya, from Western Kenya, in a community called Karachuonyo. This is in Homa Bay County. My community is a fisher folk, so we fish a lot. We love fish, especially tilapia. So I was born in my village many years ago. And like I was telling colleagues earlier, I was born right in the river. No hospitals when I was born in my community. So literally, my mom went into labor when she was fetching water from the lake, and that's where it happened. So I was born in water, and that became who I have become. I love nature. I love being in water. I love the environment. I love animals. So everything about me is linked to nature. Now, over the past couple of years, climate change has affected my community in more ways than one. So first of all, forest cover has completely diminished because of the need to cook using biomass in the form of charcoal and wood, and that is the only thing that has been available to the community. The tree cover has completely diminished. What that has done is now in the present day, we have long periods where there's no rainfall, and without rainfall, we have drought. Now, when you have a drought, that just means that there's food insecurity. And so in the present day, we have seen people going without food. Malnutrition has become a big issue now, and also people dying out of hunger. And those who keep their animals have also seen their animals die. And this is really something that's not just happening in my community in Karachuonyo, it's also happening in northern Kenya. So it is something that is affecting different parts of the country. The second thing that has affected our community is the changing lake ecosystem. So we have the part of Lake Victoria now that has water hyacinth. What this has done, it is limited the ability of people to access fresh water from the lake, one, and also the fish has greatly diminished due to this disease that has impacted a big water source that communities have been focusing and using for their livelihoods. And so you have a double disaster where people are not able to farm and grow their food anymore, and they're also not able to fish and get clean water and fish from the lake. And so that has greatly impacted their nutrition and health. And then the final thing that is very dominant now in the heat is lack of access to clean water. The water that's affected by hyacinth is contaminated. For communities that live far away from the lake, they absolutely have no water because of lack of rainfall. And what I have greatly seen affecting my community now is for women and young girls, sexual and reproductive health and rights has become an issue because lack of access to clean water means that you're not able to be hygienically clean in the midst of this all. And then I want to close the intervention by saying that we also do not have clinics in the area. So what happens is when people fall sick, they do not have access to healthcare. The closest healthcare facility is millions of miles away, with roads that have been washed away over time by flooding. When the rain comes, it comes heavy and it washes away the soil. And so we have a road also that has experienced soil erosion, and you cannot pass through it. So the challenges are dire, not just health, but affecting the entire livelihood of the community. Thanks.
Thank you so much. And that's a really good message to be able to resonate our title, which is Climate, Health, and Equity, and health access as well. I was wondering now if we could go around the panel, and starting with you first, Pasi. All of you are working in your communities to try to protect them, protect their health and their livelihood. And I was wondering if now we can move on to some of the things that you and your teams and groups are doing to decrease and limit the effects of climate change in your communities. Thank you.
Thank you, Carrie. I love the topic for today's panel because it's climate change is personal. So I'll start from there. What am I doing at a personal level to help my community deal with this plight? So the first thing I'm doing is I have been planting a fruit forest in my community for the past 6 years. So I have studied the land. I have come to understand what kind of trees used to grow there, and I'm diversifying those ones with fruit trees so that I'm not only increasing forest cover slowly, but that I'm also, over time, when the fruits begin to ripen and become mature, we're helping people feed themselves using the fruit trees. I'm happy to report that when I was last in my village 2 weeks ago, I harvested a lot of bananas, sugar cane, and was able to share with the community free of charge. So I don't sell my produce, I just share with the community who need it. So that's what I'm doing at a personal level. As a community, I have been, together with my peers, encouraging people to plant more trees. So when we do go there, we do come with seedlings to increase forest cover, as I mentioned, but also so that it becomes a collective effort by everybody. From my official work, we're constantly trying to influence policymakers, especially from the county governments, to begin to take more seriously the plight of the people. My community has unfortunately been neglected. And every time we have tried to raise our voices for the government to come in and help deal with the situation and make it better, we have been given promises that have not been forthcoming. So a lot of advocacy going on. We're raising awareness, but we're also bringing in the community to find sustainable forms of improving their lives, working together with organizations and charities that are willing to bring in resources such as clean cooking fuels and technologies. We're empowering young people. We're building and digging boreholes. So doing the little that we can at the community level while encouraging greater participation of national government for collective intelligence around what is happening, but also collective action as a whole.
Thank you so much. Carolina.
Well, as a community health worker, I always advocate and teach members and doctors to help their patients and their consumers how to stay active when it comes to this, to climate change, because it has an impact our members and how to get their medication and where to go when something like this is happening to them. And also, I feel that by educating churches, not only providers, and building gardens around the community like we're doing right now, and teaching the kids where the food is coming from is very important. We have to start from the kids in order for it to change. We cannot go back, but we can move forward. And teaching our kids how important is having clean water, having clean food, and having a clean environment, and being able to go outside and play without feeling that they have allergies. And I think doing that and also keeping the environment clean everywhere I go is very important, and not only promoting recycling, but also promoting health and keeping the environment safe for everybody.
Thank you, Carolina. Shweta.
I think our intervention is at two levels. One, we believe that it's absolutely important that communities that are adversely impacted need to tell their story. So documenting the lived experience of pollution, climate change, displacement, trauma, and be able to articulate it in a manner that it reaches to people, reaches to policymaker, and tell those stories, making the invisible visible, is key part to the work that we're doing. So when it comes to pollution, using our bodies as monitors to tell whether the air quality is good or bad, or documenting the lived experience of that pollution, that be it air pollution or water pollution or health impacts, and using that as evidence to mobilize communities, mobilize policymakers to hold the violators accountable is one of the key ways that we're intervening. And the second, again, very important point of intervention is with the healthcare community itself, because we believe that the healthcare community is at the forefront of the collective climate and health trauma. So not only do they respond to this crisis, but they themselves and their functioning gets affected because of the climate crisis. In floods, we have seen when communities need their health facilities, the facilities are submerged and dysfunctional. So working with the health community in terms of climate-proofing health facilities, designing health facilities or reimagining health systems that is community-centric, that is more focused towards prevention than curative, and at the same time also working with the health community to reduce its own climate footprint, the carbon footprint. And healthcare has a significant, almost 5.2% of greenhouse gas emissions. So how do we move towards a health system that is not doing any harm? And in the business of healing, you cannot hurt people. So I think the interventions are at these levels. And finally, mobilizing the healthcare voices. I think that's super important, and that goes back to what Renee said in the document, in the clip also. The healthcare voices is one of the most trusted voices. We have seen it time and again, and it's time that their intervention is at two levels: lending, validating community concerns and lending that evidence-based knowledge to improve community situation, at the same time intervening at policies to influence better policies. I think there is a huge role that the health community plays, and we're working in sort of tapping and working with the health community on that. That is
We, the people, we, the people, and we working together with the government is very important. But the government making our needs priority is very important too. And by taking care of the environment and making a law to protect the environment, to have his people healthy, is more than priority. we are going through a climate change constantly, more than before in the last 20 years. And I think it's time to take it personal. And when I say take it personal, and when you guys say take it personal, it's taken to the family's home culture and go into those homes and make it personal. And not only recycling, and I'm going to repeat myself, not only recycling, making those laws personal so people can go to the ecosystem and see how the rivers, the water, the food is contaminated, how is the weather affecting them when we have a tornado, when we have a hurricane that we had to migrate and take the kids from another school to another one, and also destroying homes, streets, like electricity, damaging our communities, our villages, and also keep it that as priority, no matter what party of the government you belong to. And that is, for me, that can be affected if we work together. Make it personal, advertise, showing people, educate providers, educate teachers, educate parents, educate community outreach worker like me, so we can educate our members. Make it priority, make it a law, the education. Having groups go out in the community and go out into the ecosystem and see what is affecting, and showing kids, taking parents to do the ecosystem with the kids, and taking people in general. I mean, all of us, not only in Massachusetts, all over the country, and make an example in how can be this done. How can we in 2023 and we're still using gasoline? We have electric cars. We have many ways to keep this planet safe. Why are we still using hairspray? Why are we still using harmful nail polish or plastic bottles? It's more than recycling. It's a compromise. We had to compromise ourselves with ourselves and take it personal, and make the government take it personal too. Thank you.
Great. I thought Shweta was going to go before me. So I strongly believe that prevention is better than cure. And so for current and future policymakers, my message to them would be, how are we preparing for events now that prevent a future that is devastating? And so I would strongly call upon policymakers to look into, one, their climate and also sustainable energy policies, and strategize towards implementing these now so that future generations can have a planet to look forward to. And not just any type of planet, a planet where people are healthy and living sustainably, but also a planet that is free from disease. And when I say a planet that is free from disease, I mean, how are we thinking about our ecosystem, our biodiversity, our animals, our wildlife, our oceans? Because we as human beings exist and are healthy because the other parts of nature are living and are thriving as well. The video that was shown earlier was evidence of that. Our lives continue if the world and the planet is healthy in itself. So that's one. We have very incredible policies. We've had a lot of development ambitions, sustainable development ambitions. We go to COPs every year and hear promises and pledges and commitments, but unfortunately we are not seeing these coming into fruition. So I think it's about time that policymakers, but not just policymakers, everyone, because it's our responsibility at the end of the day, collective responsibility, took action towards ensuring that our planet is healthy and that our people, our unborn, the nature, the animals are also healthy and protected. So this would be my message.
But I'm basically going to reiterate what my co-panelists have said, but most importantly, I think the evidence is clear, the science is clear, the path is clear. What we need are policymakers to have political will and courage to take those actions. We've elected them in these places for them to take action and not procrastinate. And I think we have seen enough of the procrastination or delay in favor of fossil fuel industries particularly. I think we need an end to that. And if our policymakers are not cut out to do this job, then better give it to somebody else who is to. I think it's time. I mean, this is non-negotiable. I don't think that we can wait any longer on this. And for individuals, I think we all have a role to play, as Pasi said. And I think the most important role as individuals we can do is hold our governments and our policymakers accountable. It's time that we do that. Climate action requires bold action, courageous decisions, and it's time that we see that more than just pledges and promises.
Thank you very much to each of you, Pasi, Carolina, and Shweta, for coming here today, for participating into our panel. We really appreciate members of the audience being able to listen to your voices so that we can take this forward, create coalitions, create change, and move that forward. So we hope you'll come back and make sure that we can be accountable and responsible for so many of the items that are going on and issues being discussed here at the Climate Action Week that's sponsored by the Salat Institute. I want to thank you again for coming here.
Thank you so much. Thank you so much. Thank you.
Thanks. As we head off stage, I'm pleased to announce our next panel, which will be moderated by Dr. Louise Ivers. She is the director of the Harvard Global Health Institute, and she is also professor in the Department of Social Medicine and Global Health. So thank you so much, Louise, for coming and for introducing your panelists.
You're going to introduce them. You're going to introduce them. I don't have the
So I'll really quickly, so excited to have all of you here. So do you mind going through your introductions with Louise, and then we'll introduce the panel. Thank you.
Hi, everyone. It's great to be here. Why don't I go ahead and just introduce everybody. We have Chris Golden, Assistant Professor of Nutrition and Planetary Health at the Harvard Chan School of Public Health. Welcome. Jennifer Leaning, Senior Research Fellow, the FXB Center for Health and Human Rights at Harvard University. And Abrania Marrero, Postdoctoral Research Fellow at the Harvard Chan School of Public Health. Welcome, everyone. Sustainable Development Goal 2 is for zero hunger. So ambitious aim to eliminate hunger and malnutrition by 2030. Yet a recent report, Global Food Security Report 2023, was really a striking indictment of a lack of progress in that area. And 250 million people in the world are suffering from acute food insecurity, an issue that we know has really important impacts on physical health, on mental health, and on behavior as well. So I'd love to turn to each of you. We'll go one by one to talk a little bit about your work in this area, and then we'll get into challenges, solutions, and we will be taking questions from the audience towards the end, so please get your questions ready. Chris, your research focuses on environmental change and its impact on human health and population health, especially as it relates to biodiversity loss and ecosystem change. Can you tell us a little bit about your research and your work?
Sure, I'd be happy to. Thank you, Louise. The focus of my research is really centered on this emerging field of planetary health. So looking at the human health impacts of environmental change, whether these changes are looking at biodiversity loss or fisheries declines, urbanization, climate change. Each one of those types of ecosystem transformations will have some sort of impact on human health. And the ones that I look at most specifically are ones that destabilize food systems and then position certain types of populations into food vulnerability. So I guess to make this a bit more concrete, I've been doing work now for almost 25 years in Madagascar. I've more recently been doing research in the South Pacific. And in thinking about climate's impacts on sea temperature rise, on ocean acidification, this will then have downstream effects on coral bleaching, which then threatens the ability for fisheries to reproduce and provide seafood as a traditional food to indigenous cultures and many people from the global south. And so all of these elements of climate change will have these cascading effects that will then ripple through our food systems, both reducing access to these foods, the quantity of these foods, and also the way that they're distributed. So if we look at the way that COVID-19 has played out in fracturing an already vulnerable and fragile food system, climate shocks will do very much the same. And so it's all of these sorts of interconnections that I try to investigate in my research.
Great, thanks. We'll hear more as we go forward. Abrania, you study nutrition, small-scale farming, and climate resilience, especially focused on small island nations, and especially Puerto Rico. Can you tell us a bit about your research and what you're seeing?
Yeah, so studying food system dynamics in small islands, especially an island I'm deeply and personally familiar with, is kind of like conducting research in this kind of microcosm, very reflective of broader systemic changes occurring in the rest of the world. So, for instance, many island nations, like many settings in the global south, they have these common histories of coloniality. So here I'm going to be referring to these relationships that current island nations have had and continue to have with larger countries that have this undue influence on the politics and economies of island nations that ultimately really create differences in power and marginalization that affects local people's capacity to produce their own food, to protect their own lands, to preserve their cultural traditions, and ultimately to resist the effects of a changing climate, largely instigated by the larger countries themselves, right? So we'll give an example of what this looks like in Puerto Rico, where I conduct my research. Puerto Rico has this set of very vastly and diversely different landscapes and ecosystems, coastal, mountainous, forest, aquatic, that really up until the 1950s was producing the majority of locally consumed food. And this, what we'll call food self-sufficiency, really was sharply interrupted as the global food system industrialized, right? And kind of trade policies began to relax, resulting in this influx of what were mostly highly processed foods. So today, estimates suggest that about 85 to 90% of the local food supply in Puerto Rico is imported. And this radically affects nutrition, people's health. It radically affects food security, especially after disasters and infrastructures are debilitated. It affects local economies and local livelihoods, local ecosystems, right? So these dynamics, they're important to understand in this setting as they reflect larger power dynamics within the food system.
Thank you so much. It's an important connection to what I'm going to ask Jennifer about, to speak a little bit about the broader context in which your work falls, looking at the current humanitarian crises and how food security and conflict and migration are interrelated?
Thank you. Thank you very much, Louise. Can you hear me? Thank you. Yes, I have spent more years than I care to count looking at wars and forced migration. And in that context, I have seen the misery of people who are affected by armed conflict, particularly internal armed conflict that is between and among people, but within one nation state. And the problem with internal armed conflicts, that is within the boundaries of one nation state, is that international humanitarian law is relatively thin with regard to what's right or wrong compared to international armed conflict. And the major players in the world in terms of humanitarian aid, and also, of course, in terms of creating significant destruction, that we just talked about, tend to seek to avoid getting involved with internal armed conflict because it is messy. So as a result, I mean, politically messy, culturally messy, and as a result, these internal armed conflicts persist for a very long time, kill an astonishing number of people because there's no one there who's in a protective mode, and leads to populations fleeing from the site of the armed conflict into what are putatively safer places within the boundaries of their own nation state. But sometimes the boundaries of their own nation state are not safe, and so then they go into other countries in search of safety. So my work has been to hopefully, if I can, get into the country where the armed conflict is going on and report back on what's happening, interviewing people who've been affected. They fled from the rural areas into the city, and I talk to them in the city. Or I go to bordering states and speak with them, talk to the refugee community, the international community of response and humanitarian relief. And during these years, I have become more and more aware of the influence of climate change. So I began by teaching about war and human rights, and I have come to this point in my career to speaking about climate change as the underpinning issue relating to world distress.
Thanks, Jennifer. Can you say a little more about how you see that shift has happened and some more specifics of how you're seeing now climate change and its impact on those international relations and issues of the future?
Well, so perhaps I can give you an example. The war in Syria, which began officially in 2011 with an uprising of enraged urban populations in the western part of Syria, Damascus and other towns, Hamas, a number of towns. And that uprising was put down brutally by the president of Syria, who still is in power. And that conflict, which began in 2011, has somewhat petered out as of 2020, with President Assad ostensibly still in power over a much diminished, shrunken state, and with beginning with a population of significant size, over half of his population is now in internal displacement or has fled elsewhere to Europe or neighboring states. So he is presiding over a very diminished country in many ways, ruined and depopulated and riven with hatred. It's not an exaggeration. And as I studied this, I realized that, and first talked about it, and working with colleagues from Syria as well as the Mideast more generally, I said, you know, this is significant. In the years, say, 2008 onwards, a very serious drought hit in northeast Syria and affected the livelihoods of farmers and pastoralists, but essentially farmers who were forced by the president to grow wheat, which is very water intensive. It linked with fights over the water of the Tigris-Euphrates. But wheat was irrigated from the rivers. The wheat crop failed. Then the millet crop failed. Then the farmers began to give up and try something else or move to the towns. The pastoralists began to move. And by 2010, over 1 million people left the northeast of Syria and traveled hundreds of miles to the western cities of Syria, flocked into Damascus and some of the other bigger towns, and began to strike and ally with unrest in the cities because of Assad and his oppression, to demand change. First, they wanted their children to go to schools. There's no room. Second, they wanted jobs. Third, they wanted food. And they were very desperate. And these crowds joined the other forces that were extremely upset with the autocratic rule of President Assad. And that led to revolution in the streets of unarmed people. Assad had his military fire live ammunition into the crowds, and the conflict escalated, and then the war ensued. Those who rebelled in some ways lost. They were forced out. The remnant is in northwestern Syria, which you've heard about now because that area was as affected as southern Turkey by the major earthquakes that happened a month and a half, 2 months ago. So it was there that I began to say, this is a war that was sparked by unheeded climate change and terrible agricultural and water policies on the part of the state. Could it have been resolved in a different way with a different government who was paying attention to what the needs of his people were, not just his own caste and class and religion, but the people in a diverse country? Could that have been abated by good governance? I believe in the short run it could have. So this is the pivot point in my thinking. 2010, 2011, I began to appreciate the role of climate change. Although I had worked in Darfur and had been part of many fights with very principled people. Is this ethnic cleansing? Is this genocide? Is this climate change at work? And that's another conversation. But in any case, it's been present in my mind for quite a while.
Yeah, thanks for sharing that. And the same report that I mentioned, the Global Report on Food Crises, talks about 3 major drivers of food insecurity: conflict, extreme weather, and economic shocks. And we can see from your narrative just how closely intertwined all of those things are. Chris, I want to turn back to you, and Jennifer has spoken about these large-scale forces. And also we know that food insecurity is very personal too, and our first panel spoke about some of that. Can you talk a little bit about your work in Madagascar and the mental health impacts of food insecurity?
Sure. So in hearing Jennifer speak, I see so many connections to the work that I do in Madagascar. Madagascar is an incredibly diverse ecosystem where there is dry deciduous forest to the west, rainforest to the east, a kind of spiny center, and then in the south there's a quite arid environment. That's actually a desert. And over the past 5 or 6 years, it has been experiencing drought and climate-related impacts that have led to famine in what the kind of World Food Program and World Health Organization have hearkened as the first climate change-driven famine. So none of these kind of other external social and political or economic factors that are driving it, but strictly a result of climate change impacting the underlying ecologies of food production systems, leading to a lack of food for people. And so what I see is that there is extreme harm being done by this kind of external anthropogenic climate change, where Madagascar produces less than 0.01% of all of global emissions, and yet is now sitting front and center to bear the burden of all of the impact. And what we're doing now with a PhD research student of mine who is the first Malagasy citizen to do his doctorate here at Harvard, which is really exciting. He will be running mental health surveys to actually document the prevalence and incidence of a variety of different mental health disorders, including anxiety, depression, trauma, and even suicidal ideation, with respect to all of these climate drivers. Because when we consulted people as to what was actually influencing their mental health, so many of these stories stemmed from their deep sense of place, their deep relationship with the environment, and how that has begun to rapidly change. And these unfolding events have such a cataclysmic impact on people's psyche in terms of their ability to see a hopeful future where they will be able to live in their traditional ways, much like their ancestors have done. And so I think that unveiling some of these kind of more hidden impacts of climate change is so critically important to pulling policy levers.
Yeah, thanks so much for that. And Abrania, back to you, because it relates back to something you made a comment on in your opening comments about the individual impact. And can you tell me a little bit more about how the lack of food sovereignty and the food insecurity impacts the traditional ways and the traditional methods you discussed?
Yeah, so our research is very much informed by local calls for food sovereignty, to really relocalize and decolonize food production for the sake of human and planetary health. So despite that call, right, and the importance of thinking about what people want for their own food system, it's still important to actually show that local food production can actually improve nutrition and human health, right? And so our research has linked local food purchasing with improved nutritional status, with individuals who consume locally produced foods consume higher or more dietary fiber, lower saturated fats, more fruits and vegetables. And this makes sense because traditional food practices and dietary behavior, dietary patterns, they're very much sourced from minimally processed agricultural and seafood products from these environments, right? So if the call is to increase local food production in a setting that is vulnerable to climate change, then we must not only promote local food eating at the consumer level, we must also make sure that we work with smallholder farmers and other small-scale food producers in these settings to make sure that they can increase their production and do so in a way that is resistant and adaptive in the face of ongoing effects of climate change. So traditional knowledge systems bear these practices, and we can learn from how, for example, diversity in crop production, agrobiodiversity, in contrast to large-scale monocultures, really promotes not only soil health on farms, but also improves livelihoods by having kind of different income sources from different crops across the year. It also, in that way, improves food security. So thinking of ways that we can learn from diverse small-scale food producers that are already working in adaptive ways can really help us think about what are the practices that we can learn from on a broader scale.
It's great. I'm glad you've turned the conversation towards solutions, because that's what I wanted to speak about for the rest of the discussion, or at least a good part of the rest of the discussion, especially because it's Climate Action Week. And it's nice to think about, or important to think about, the actions we can take. If I stay with you, Abrania, you mentioned some of the things that you're learning. What about the things you're learning in Puerto Rico are applicable to other small-scale farmers? Are there specific agricultural innovations, or maybe not innovations, actually traditional practices? What should we be learning, and how can we disseminate that or ensure that those learnings are used throughout the world? Is that appropriate?
Yeah, so crop diversification is an example of a really maybe technocratic response to this idea of what we can learn from traditional knowledge systems in these settings. What I'd like to surface and bring here to the table is that farmers, in Puerto Rico, jibaros, they're they're cultural emblems. They are part of this cultural story about who we are, who we were, what our land is, what our land once was, right? When we were conducting narrative interviews with smallholder farmers after Hurricane Maria to ask about these climate resilient practices, one of our participants said, un pueblo, and this word that means a community but also means a people. Un pueblo without agriculture is a pueblo without food, and a pueblo without food is a pueblo dead of hunger. And so there is this integrality to food and farming as essential to community lives. Farmers, they produce food, they grow food for themselves, for their families, for their neighbors, as an act of solidarity, as an act of relationality, as an act of love. And this relationality exists not only between people, but also with land, right? So farmers will talk about their crops and watching seedlings grow in a similar way that they talk about their children grow, and that the farm is a family. And when Hurricane Maria destroyed their farm, there was this heaviness in the air. So yes, there is practices that traditional farming communities can teach us, but there's also this wealth of value systems that we can learn from, and how we can really conceptualize a true stewardship of the earth and the relationship that we have with each other and with nature.
Yeah, thank you. Chris, you've also done some work related to climate smart public health and work with technology. Can you share with us what looks promising in that arena?
Sure. Two things kind of come to mind when I think about this. One is what we have proposed to do in Madagascar is to develop a system of climate smart public health. So we've engaged with the ministry now over the course of a decade to work with them inside their own information systems and then overlay data on climate, agriculture, environmental data, and use remotely sensed features and products and all of the data that comes with that, whether it is being updated on a daily basis or every few days, every few months, to look at the ways in which environmental, climate, and agricultural change are associated historically with ill health. And the ministry's databases have roughly 50 different conditions that we can look at over time. And in so doing, if we can look at this mechanistically, can we then create early warning systems? So can we predict where the climate is going to go, where the environment is going to go, what will happen to crop systems, and then seek solutions before they actually unfold? So can we allocate food aid in more efficient ways to vulnerable locations? Can we think of medicines and allocating medicines to clinics that will need them based on our predictions of where epidemics might pop up given historical data? And so it's really this combination of kind of spatial epidemiology with artificial intelligence and machine learning. And so I'm enormously grateful to folks like Francesca Dominici and Milan Tambe and Peter Hybers and Michelle for kind of driving so much of this collaboration forward, where we can actually really be working in such a meaningful way to have an impact in a country where there are such diverse ecosystems that all of these different connections will play out in very different ways and yet have a tremendous possibility for scale. So the way that they've designed all of their health data, it's now part of the DHIS2 system, which now composes roughly 70% of all global health records at national levels. So whatever we end up designing for climate smart public health could be scaled elsewhere. At a far more local scale, some of what we've been doing kind of in collaboration with folks over at the School for Engineering and Applied Sciences is kind of bringing us back to this famine in southern Madagascar and thinking about ways that we can actually do more upstream and holistic interventions to provide food aid rather than the kind of care packages that drop dried peas, which are incredibly important and yet not necessarily sustainable or economically feasible in many cases. We're working with a team to actually create artificial coral reefs to rehabilitate the coral reefs that have been damaged all along the southwestern coast of Madagascar. And these were not damaged by climate, so it's not like we will build them and then they will just be destroyed again. But they were damaged by local fishermen who were using destructive gear and are now being engaged to help actually rehabilitate the reefs themselves with our partnership. And so the idea is that once we do this, we can then rehabilitate fish stocks and provide sustainable access to seafood to coastal communities who are living adjacent to parched agricultural land that is no longer able to be productive for their staple crops. So there's a lot of different ways in which we are perceiving technology could be hugely impactful on the sorts of research that we're doing.
Great, thanks. Jennifer, back to you, a bit about the geopolitics of all of this. One issue that you've mentioned, and you talked about drought, and water security is obviously really connected to food security. Can you speak a little bit about how nations or countries or regions should be preparing or could be preparing for threats to their water systems and how that might impact in the future?
Well, I think that climate change, independently of all the other stressors on many populations in the world, climate change is having an inexorably greater impact on their lives. And the sort of fine-grained, highly curated, intelligent work that our two panelists are doing in two island states, I would say, which has a boundary about it. People cannot vote with their feet that easily to leave. I mean, I say that in the context of Puerto Rico, where in the past, many, many people have left to come to the United States or to go elsewhere. Madagascar, it's less of a 20th century phenomenon. But there are many people that are trapped in large land masses that are now in a situation of not yet armed conflict, but of degradation of their environment to the extent that the risk is they might actually leave their land. And so I'm working with a group that includes people from the public health school and Hughes and some of the same people that Chris is working with on a large-scale assessment of India and the impact of climate change on India. And we're particularly looking at very poor women who are not in the cities, who are, well, there's some of them are in the cities. They work with self-employed people in the cities, which is a large population. But they also work with many people who are farming and doing other very hard works, like collecting rock salt from the rock plains in Rajasthan. Okay. And the interest in working with women and seeing their sense of what is actually possible, what's going on, what's possible, is in part because women sustain much of the economy of rural India. And the part of this work is first to see how difficult it's become with climate change. And a very big issue that we are beginning to zone in on is the problem of heat. Not drought, of course, is quite significant, but heat and heat waves are becoming, heat is becoming more intense, more sustained, and heat waves are much more common now than they were years ago, decades ago. So I mean, there's a climate record that shows an increasing prevalence and incidence of these major issues relating to heat and drought. And a good colleague of mine, Sajid Balsari, has worked and done some work in Rajasthan looking at the women who collect the salt. Okay, so let me just tell you how awful it is. These are women who have moved from their own villages to get money working in the flats of Rajasthan that have the rock, the salt rock from, first there's water, then the water drains, and then the salt plains are there, and they're dry. And they collect salt, huge rock salt, from the plains of Rajasthan. And it's dry, it's hot. They live in if they have any cover, they live in tin huts, tin roofs, very little access to potable water. They have to carry their children on their back, the little ones. The ones that are toddlers and can be in school and back at the villages are there with grandma, et cetera, and the extended family. They work very long hours, daylight hours. They're given thong braided rope sandals, which in the rock faults disintegrate quite quickly as they're moving around, bending, and then carrying these very large bags of rock salt to where they deposit it. They are always dehydrated. They have very little food. They cannot wash because there's no water for washing. So they develop terrible sores. The women have, just very, very difficult gynecological problems. And they are at this tipping point where they say it's not survival. We cannot do this. They're working in temperatures that are 108 degrees Fahrenheit, and the heat is getting higher and higher in terms of the ground. And so that the question is, where is this tipping point? How can you mitigate their lives, the difficulties of their lives? What are the options? And then, of course, you turn to what we all know about, which is rural poverty in India, where the farmers are very attentive, as you mentioned for both of your island states. The farmers are very attentive to climate change. They just haven't put a name to the heat, and they have not yet developed alternatives to the crops that they are growing. These enormous issues of public policy here. But first of it is to understand what the nuances of what heat and drought is now meaning to rural India and what the range of options are. So this is where I'm working in a more field-based mode than in the human rights and war mode. And I believe it's extraordinarily important for us to understand these dynamics because we don't have very much time, as we all know. And adaptation is fundamental to getting through this. If we can't adapt and people are forced to flee, that's the beginning of generations of distress that I have seen from war and forced migration from war. That's a tipping point for large parts of the world that we must try to avoid.
Thanks. In terms of the policies, whether they're local or national, that we as an audience, we in academics, we as humans should be pushing for and advocating for, can I go to each of you to let us know what you think are the key ones we should be speaking of? Maybe Abrania, I'll start with you.
Sure. So I think in our contemporary and increasingly globalizing food system, we understand, or beginning to understand, that our food supplies were very much built to distribute processed foods, and it makes sense, right? Processed foods have longer shelf lives, they're stable, they have value-added economic worth. And so when we think about the fact that what we need to increase access to are not processed foods, are lots of whole foods, fruits and vegetables, legumes, many foods that are traditional in local diets and continue to be produced by smallholder farmers and food producers, then the goal is to really transform food supply chains and close gaps in whole food, minimally processed food access, right? So right now, the types of food that are most easily accessible both to us in the global north and increasingly to the most remote rural areas in the global south are highly processed foods. So from food industry. So how do we encourage that local peoples have access to the healthy fruits and vegetables produced by local farmers and their communities, and making sure that those farmers have access to market and that consumers have access to market.
Great, thanks. I'm going to go to Chris and then Jennifer, but just want to remind everyone we are going to be taking questions. So if you would like to get ready with questions, I think this is the microphone. Feel free, everyone's welcome to ask questions. Feel free to start lining up there. I hope you will. But I'll go to Chris and then Jennifer about policies. Thanks, Abrania, for that one.
I'm mad that Abrania went before me because she's taken much of my answer, but I will build off of it, which is that the other thing to keep in mind is that all of these processed foods have an enormous environmental impact, and that we need to be thinking of our food supply chain and our food system as not only a vehicle to deliver the nutrients that we need as society, but also as a mechanism for climate mitigation. And so to think through how we can actually pressure different systems of change to integrate not only foods that are healthy for us, but foods that can be responsible for paving a sustainable pathway forward. So right now, the agricultural system, it emits 33% of all of our greenhouse gases. It uses 50% of all freshwater resources. It is incredibly kind of implicated in all of our global environmental challenges. So we need to develop solutions that are bringing those two things together to say, how can we efficiently, fairly, and sustainably deliver nutrition while at the same time not compromising the health of our planet?
Yeah, thank you. Jennifer?
Yes, I'm looking forward to the questions because that will sort of concretize this discussion, I know. I would say that in the Indian context, which is where I'm now becoming more of a field investigator rather than a distant human rights investigator, I think that there's enormous amount of knowledge in the government and at the regional and district level. And what is starting to happen is the formation of heat action plans, HAPs, that are at the state level and then district level, where officials, there are always officials in India at every level, where officials are actually charged with identifying impending heat waves and when they're there, and also the long duration of rising heat, which is something that is very difficult to measure, but it is getting hotter, quite apart from the heat waves. And making sure that there at least is a rough sense of when people are in jeopardy from heat waves or rising heat, and having shelter, water points, stand downs, nobody forcing people to go out in the fields, places where the cattle can be in the shade, children don't go to school. So there's the heat action plan, of course, varies by community and ecosystem, but it is an early recognition, but a somewhat developed one by the Indian government at a national level, that there's something going on about climate change that's going to have particular pressure on heat in India. It's also true of the subcontinent in general, Pakistan. But the Indian context is one where we think we might have some value in terms of providing information.
Thank you. Okay, it looks like we have 6 questions. So
Okay, I'm going to go really quick here because I was just going to prime the pump. So I was wondering if you could speak to the tension between the local and all of you have really spoken to the local and the need for global solutions, because it feels to me like, gosh, if every solution has to be local, how are we ever going to stitch together solutions across the vast number of people who are going to need help? And I guess your climate action or your heat plan might be one, or the data systems, but what are the sort of generalizations of the local, and what are the platforms to do that?
Yeah, I can take a first crack. I think that there are definitely needs to always tailor and create culturally resonant solutions at local levels, but that's not to say that they are not scalable. And so many of the interventions that I look at, whether it is developing aquatic food systems to offset some of the more harmful red meat systems or terrestrial agricultural production systems, that is something that is almost universally going to be more sustainable and healthier for populations regardless of location. So there are ways of thinking of that scale. In addition, I think that a lot of regulatory mechanisms to look at the way that we do logging, mining, food supply chains that deeply influence agriculture and agricultural production are so important to have more closely monitored with these sorts of health impacts in mind. Because if we look at spillover events that come from our ever-increasing food systems, if we look at the ways that there are these knock-on effects from the way that we are currently producing food, whether it's mental health, infectious and zoonotic disease, nutritional outcomes, non-communicable disease from air pollution, from burning forests to produce food, all of these things are going to have very clear health impacts that are currently part of kind of an externalized assessment. And we need to bring that into the fold through policy to say food systems need to be monitored in such a way that we are not destroying people's health.
Could I just comment on that too as well? I mean, sorry, I agree completely with what you said. I'm thinking that at the international level, there are two things really that are crucial to continue to sustain and accelerate. One is the whole international movement around climate change, which is grassroots, but also is pushing nation states to do things like try to move away from coal production and to increase the use of wind farms, et cetera. And you can see it in the United States. You can see some of the pressure starting. You feel the kickback coming, but it is definitely the case that minds are being changed by national policies and by the world conversations. And the other aspect about international work is that the international agencies that are dealing with distressed populations in the Sahel, the Horn of Africa, it's a little bit late. It's a little bit late to talk about mitigation. Large numbers of people are already fleeing, and they're coming out of Africa where it is getting increasingly difficult to make a living. So there has to be, this is not directly related to climate change, but directly related to much of what I care about in terms of migration and refugees and relief. There have to be better policies to stabilize populations in place. The World Food Program is working on that as much as they can, but it's only one agency. But then to treat humanely and find jobs for people who have been forced to move and are often in another country because they can't make it in their own. We need to have this global recognition that we try to help people stay where they are and thrive, and we try to help people whose land or whose situation has become so degraded that they actually can't produce a livelihood, and therefore help them find another one in a safer place. Of course, easy to say, as we all understand, very difficult to do, but that doesn't mean it isn't necessary.
Thanks.
I am part of the Distinguished Humphrey Fellowship Program, and I'm actually from Madagascar, so I was very happy to have been invited here, but now I'm really, really happy. I would like to have your opinion. Do you think that we are bound to look for these so-called climate resilient seeds? Not only Madagascar, actually, but many African countries as well. Because, for example, the hybrid rice is highly promoted in Madagascar. These are imported from other countries, but it appears to be very destructive for the soil and with less yields. And the narrative is that we have to evaluate with the current context of climate change. But I'm sort of thinking that this must not be some kind of really imperative path through which we have to go. There might be some other solutions for that. Thank you.
Voloni ambulațar, mi s-o trebuie Elefantunian. I just want to first respond to your question by saying I think it's so important that we very carefully consider and stress test any sort of intervention that is coming into a country, particularly one that is not already found within the country. So there are lots of interventions that are there that we could consider scaling with little to no fear of adverse consequences, because we've already seen the way that those sorts of interventions play out. Bringing something from outside and then doing an intervention like that, you just have to be far more cautious in terms of thinking of potential adverse consequences. When it comes to the degree to which Madagascar needs to face these issues around climate resiliency, I do think to a certain extent, Madagascar, in addition to some countries and kind of small island countries in the Pacific, are really the canary in the coal mine of showing us what is happening right now at the front lines of climate change. So with increasing cyclones, with the first climate change-driven drought and famine, with kind of incredibly high rates of poverty and malnutrition, we need to be very focused and laser focused on what sorts of interventions might actually be able to help offset some of the damages that are already being done, because we're not predicting things into the future, we are actually evaluating what's currently happening. And so I completely agree with you that this needs to be done in concert with local, traditional, and indigenous values. But we also need to be innovative and adopt the parts of technology that can help us accelerate some of the ideas that are brought forth through this more participatory approach to intervention.
I'll just very quickly add to that. I think, climate resilience is certainly the buzzword, especially in spaces such as the one that we're currently in. I think it's important to recognize that oftentimes resilience is a word that's really reserved to describe populations that have histories of marginalization, and that really distract us from imputing responsibility for those stakeholders around the world that are truly responsible for, in this case, the effects of climate change, right? So while to a certain extent it is inevitable to think about solutions for mitigating and adapting to and resisting the effects of climate change, especially in marginalized populations, there is still a strong need to think and to hope that the effects of climate change can still be prevented, and that the actors who are responsible take on that role of preventing further harm.
Thanks. We're almost out of time, so I feel like we could take 2 more questions if they're quick, but I don't know, unless they're super speedy. I just want to see if we got, I encouraged everyone to speak, and now I want to see how we have time.
My question will be challenging. We know we have to have actions, but actions require decisions. I am a farmer. I inherited a piece of farmland in Illinois. My brother and I have to make decisions. We're both highly educated, probably too educated to make the decisions. It currently grows corn and soybeans. From the Department of Nutrition, I don't like the corn, I like the soybeans. Then the first decision was, do we put wind power on the land? Because it's Illinois, it's flat. But the wind power means a big concrete base and the wind stack itself. What if that goes out of business? The next decision that we now have before us is, do we put solar on the field? Because it's dirt farm, it can't have crops that are silviculture, the cattle and the apple orchards, which we would love to have. We can't have the solar that is tilted so that the water falls at the bottom and the sheep eat the crops at the bottom of the solar panels. So we would then have to have dead fields. We do have a tenant farmer, but the tenant farmer is getting older, and we will continue to have a tenant farmer. The actions require decisions, and you need staggering amounts of knowledge to make the correct decision for the future, because we know we've made a lot of bad decisions in our past. Urban renewal is one. So what would you recommend that people do who own the land so that they're making the right decision for the present, but also for the future?
Well, this is a U.S. question, isn't it? Yeah.
Illinois is pretty U.S.
Yeah.
Yeah.
So I'm not a farmer, and I'm not as expert as either of you are in agrarian systems or fishing systems. I think fishing systems don't really apply, right? No. So could I just say that I live on Martha's Vineyard, and the same debates are happening. Yes. That is, wind farm, solar energy, change the crops, what about the animals? Much smaller farms. And I believe that this is a time to challenge the state authorities, which is what our island is doing, along with a lot of farmers elsewhere in Massachusetts, to come up with some productive and pretty well tested and integrated suggestions as to which comes first, what comes next, what comes farther along. And I think the fundamental problem is, first of all, that nobody really knows. And secondly, that each of these investments, as you lucidly pointed out, wind farms, solar panels, having big transmitters go across your field, right, for electrical transmission, are pretty permanent and expensive, at least expensive, and very hard to move back from. So I believe that this is a problem that faced the U.S. government with the Dust Bowl, from 1930 to 1920, 1929 to 1930 in much of southwestern U.S. And that was basically due to poor advice given to farmers, okay, and incentives to have them farm in areas that were really not tenable for farming. And they got no good answers until millions went to Southern California and elsewhere. And it was only over the next 15 or 20 years that people realized that you couldn't farm the prairie. So I'm afraid we're in this lull point, which is terribly important to get over for all the reasons you're aware of and people in this audience are. And so I empathize. I have no solution for you except to observe that it's relatively universal in the United States. And the previous time it came up with the Dust Bowl, it was not resolved in time.
Yep.
We're going to take one very brief, I hope, could we? Very brief question, if possible, and then we'll try to stay on time for the rest of the afternoon.
Okay. Hi, everyone. My name is Idongesit Samson. I'm a public health student at the Chan School. I have two questions. I'll try to be brief. First one is for everyone. You've highlighted some of the specific policies that we should be advocating for. And so my question is, what in your experience would you say are some of the most effective ways of linking the findings from all of the work that you're doing on the field to actual policy or implementation stage, and not just at the stage of adopting these policies, but actual policy adoption and implementation, such that we're actually seeing results? Because I personally feel there's some kind of disconnect between what's happening on the ground in terms of research or findings versus what is actually being translated into action. Second question is for Chris specifically. I'm curious about the work ongoing in Madagascar, just considering, and I think it's great that we're finding ways to integrate climate action with public health systems. I'm curious to know what some of the strategies on the ground are for sustainability in terms of human resource and financial sustainability. And I say this with the context of Africa, where you have a growing health system, I would call it, where you're typically trying to get the health workers to do the job, and financial resources is always a constraint. So I'm just curious, with integrating the additional component of climate change, what you think some of the measures that are either already in place or that would be useful for sustainability long run, what do you think those interventions or measures would look like?
I'll comment very quickly on your first question. Thank you. I am always very surprised and shocked at how subsidies from the government have such a profound effect on food systems and agricultural production. I mean, certainly we know the history of agricultural subsidies in the United States, for example, and how, the Farm Bill, makes the production of wheat and other kind of grains very cheap to produce, and corn, of course, as our previous question, how that really drives what is produced, which ultimately leads to a very animal-based food supply, fast food, et cetera, et cetera. That is an example in the US context. When I was talking to farmers in Puerto Rico, that holds. There was a government subsidy that was put into place right after Hurricane Maria, and it was to promote hydroponic production on the island with some purported scientific evidence that it might be beneficial in this setting. I can't comment too much on whether that is in fact the case, but I can comment that every farmer that I talked to knew about this subsidy, and if they had the resources, were implementing hydroponic production along their, their traditional subsistence practices. And so when money is flowing in to farmers, like it is a very quick way to make change. Now, what's important for us to think about is what are we going to subsidize and what are the unintended consequences that we are not yet aware of when we choose to subsidize.
Thank you so much. I'm going to hope that the rest of the questions can be discussed in the break. I know there's a break now for 10 minutes, and everyone's welcome to enjoy outside some refreshments. Thank you to our panels so much. I really appreciate the conversation. Thank you.
We'll see you all back here at 2:45 to be able to discuss with Melissa Hoffer, the climate chief of Governor Healy's office. Thank you.
Here all day. Yeah.
Totally.
Yeah, no, this was really great. Yeah. Lovely to meet you. Yep.
I'm coming in for a hug.
Or we're just going to change.
How are you?
The most strong and poor population. And you come after Harvard, I said, oh, let's talk to lunch. And we go to
Yeah, I'm never gonna open this one.
I think we're going to start very soon, so I'll give people some time to get the rest of the line of the coffee done, and then also please come inside. And if you can, please move one seat in. There are many people that are sitting on the aisles. If you can sit one seat in, that would help us as we generate like.
The speakers right behind me. So that's why you can. Where do you want me?
I'm gonna go turn her mic down a little bit.
Okay, thank you so much. I want to make sure that we have time to speak with Melissa Hoffer, who's the climate chief from the governor's office. We really appreciate your time in coming here today as members of the audience, and welcome back. I am so excited to start the next portion of our program. With me is Melissa Hoffer, who has a one-of-a-kind job. Massachusetts is the first state in the nation to create a cabinet-level position for a climate chief. And Melissa is the first person to hold that role. Yes. She comes to the job with deep experience at both the EPA and the State Attorney General's office. Now she has a remit to tackle what she calls a defining issue of our time. Welcome, Melissa, and thank you for joining us. So we know there's an urgency. I want to start with the big picture. What are the parameters of your job, and why is it important to have a climate chief?
So I think I'm going to take those in reverse order and talk a little bit about why it's important, then we can talk a little bit about what. And the why is, at least in Massachusetts, and this is true for other state governments and until recently even for the federal government, climate was largely seen as an environmental issue. So that was something for EPA to take care of. Here in Massachusetts, it was something for the Executive Office of Energy and Environmental Affairs. It expressly was something that our DPU could not consider. And even though we had good climate legislation, since 2008, Massachusetts has had some of the nation-leading pieces of legislation, including our Global Warming Solutions Act, our Green Communities Act. But even with that, it still really lived mostly within the realm of planning. Now, we've done a very good job of decarbonizing our power sector here in New England. And that's in part because we had the Regional Greenhouse Gas Initiative, which was the first ever regulated cap and trade system for a power sector in the United States. And it was also a function of the discovery of Marcellus Shale, which made the demand for coal go down tremendously. So we've been able to accomplish some things, but we haven't really seen climate become an issue that is integral, that is in the bones of the other agencies, the Department of Transportation, for example, Health and Human Services, Emergency Response, A&F, our Administration and Finance Agency, and I'll talk a little bit more about some of the things that they're doing later, that is responsible for buying all the things that the state uses. States and federal government buys an awful lot of stuff. So those purchasing decisions can have a huge impact on climate. So there's really not a single office that is responsible for ensuring that all of those agencies are thinking about climate change in all of their relevant decisions. So that's the why. It's really to bake climate into the DNA of all of these state agencies. It's a whole of government approach. It's not unlike what the Biden administration did when it instituted the Domestic Climate Policy Office and put Gina McCarthy at the helm of that, along with David Hayes and Ali Zaidi. So these are, if you can think about it, it's a different kind of innovation. It's an administrative innovation in how we do government. And then what is it that we're doing is the second part of the question. And that is largely spelled out in EO 604, which established the office. And it puts a structure in place that places a Secretariat Climate Officer at each of those agencies. So every Commonwealth Secretariat now has a person who is responsible for climate change, and my team and I work with that person. In some instances, agencies like EEA or DOT have very specific legislative mandates that they must accomplish. So putting that on a time frame, having regular reports on it, making sure there's an implementation plan so we understand, okay, we need to get to X many EVs by 2035. That's a great goal. How are we actually going to do that, and how do we know that we're getting there? So that's what my office has been doing. We've been doing that with each agency. Some of the agencies don't have specific legislative mandates, so we are working with the secretaries and their Secretariat Climate Officers to put in place plans that will lay out what their specific responsibilities are. The EO also created an obligation for my office to generate a report by June, which heaven forbid is right around the corner. And that report is laying out what are our strengths, what are we doing well across the board, and then what are our growing edges? Where do we need to change things so we can really hit these targets in time? And how can we learn from each other? 'Cause some of the agencies have more expertise than other, and so there's a real learning opportunity there. And I would say lastly is maybe a more ephemeral concept, but that is the one of building the connective tissue between these agencies. We have an incredible staff that care very deeply about this. Many of them are young people, and they really want to make a difference, whether they are working on purchasing or whether they are working on health or whether they are working on air conditioning in prisons. They really want to see things change. So bringing them together, we just had our first little retreat, and it was incredible. Their passion, getting to know each other, and then they're going to be the next generation of people who understand who to pick up the phone and help us get, this problem solved. So that's another piece of this that I think is equally important, along with our own relationships among the cabinet secretaries. And the first thing that I did was establish a climate cabinet meeting. We meet every week as a cabinet. We meet monthly as a climate cabinet. And that keeps all of us at the highest levels apprised of each other's work and learning from each other there.
Thank you so much. It's really great to hear from a leader like yourself and as a climate chief, the why, the what, and the how. And then also to inspire the next leaders and to be able to make sure that we have people across Massachusetts working in this area and sustaining that. And I'm wondering, as you think about your leadership in this area, what was some of the pieces of advice that you got coming into the job that you thought were very helpful to you? And then how are you going to take those forward?
Well, don't do it was a piece of advice I got from many people. And I'm glad that I declined to follow that advice. But the best piece of advice that I got was from Administrator Regan, Michael Regan, who is the EPA administrator. And when I was talking to him on my way out, I asked him, do you have any last kind of parting words of advice for me? And he just looked at me and he said, Melissa, go hard or go home. And I just love that because I admire him so much, and he's such an incredible leader. And he is somebody who really has epitomized that for me. He's come in and he's took on some issues that are really hard. Environmental justice, very, very hard. How do we solve those problems? How do you kind of change what you're doing inside an agency technically legally so that you can really make sure you're satisfying that mandate? How do you make sure that you're going to have the lens on it? So he is somebody who really epitomizes go hard or go home to me. And it also rang true because it was something like, I could really hear my late father saying something like that to me, so it really sunk in, and I often hear it.
It's really wonderful to sort of hear these pieces of advice and then also to think about what you've done so far and what Massachusetts has done. And I really want to commend you and your team and your organization on the climate action plan that is available on the web for those of you. And I'm going to make a big pitch today. So I hope you'll all go home today and look on the internet on the 2022 Massachusetts Action Plan. It's really well laid out. And in one of the pieces that you just brought up, as well as one of the items that in this action plan is on environmental justice. And we at the Chan School are really engaging communities and looking at environmental justice. I know David Cash in Region 1 EPA is also thinking about this framework and working with the WHO as well on climate resiliency, especially in low to middle income countries. And with red zoning and the unfortunate issues around our country and discrimination against people of color, I'm wondering what is your team now doing for environmental justice related issues and what can we do more?
Great. So environmental justice is at the center of everything that we're doing in equity. So it's a consideration that we have across the board. It's not something that sort of lies outside, but it's something that we're thinking about as we do all these things. And so I wanted to talk about 3 particular ways that it shows up in the climate space frequently. You know, one, we have, you have here Administrator David Cash from EPA Region 1 and Deputy Administrator Janet McCabe from EPA headquarters today. And they are in the process of putting out a transformative amount of federal funding through the IIJA or the bill and through the Inflation Reduction Act. And you know, those resources will be coming to communities. And the Biden administration has been innovative in that my read of these applications and these opportunities is that it is intended to de-silo within states. If you're a state receiving some of this funding, you kind of have to be having conversations. It can't just be, you know, a Department of Environmental Protection. You kind of have to be talking to your colleagues within DOT and within some of the other areas that are going to be responsible for building decarbonization, for example. So that in itself is good, and it's driving a lot of cross-collaboration. And you know, those opportunities require at their core you know, a benefit to disadvantaged communities. There's Justice 40, which makes sure that, you know, we're going to be investing at least 40% in disadvantaged communities. So those are the external things. But absent those, Massachusetts has long had a focus on environmental justice. It's had an environmental justice policy for many years. And so what we're trying to do with this, the 3 examples that I would like to give you. Number 1, it shows up a lot in terms of siting. We have an energy facility siting board. Massachusetts has not done a particularly good job of ensuring environmental justice considerations in siting, notwithstanding the fact that we have the policy. So about a week and a half ago, Secretary Tepper, who oversees the Executive Office of Energy and Environmental Affairs, announced that we'll be convening a siting commission. Because the reality is we have to build a lot of stuff for this clean energy transition. We're going to need substations. We're going to need interconnection cables. We're going to need transmission. We're going to need wind offshore and onshore. We need lots of solar. We also need to be maintaining our forest for sequestration potential, and we need to be, you know, protecting our coastal wetlands. So these are really tricky issues. People love clean energy, except when it shows up in their backyard. Sometimes it's the same thing. We've had a very difficult time, for those of you who know New England, citing the necessary transmission. Looks like 3 might be a charm. So these things are important. It also has shown up in citing of fossil fuel infrastructure. And I think, you know, without commenting where that particular matter is, we've heard a lot from residents out in Springfield and Long Meadow about the proposal to have, you know, a $65 million gas pipeline put right straight through a number of environmental justice communities. So I am personally taking time with that. I am looking at that. I am carefully monitoring. I'm hearing from communities. I'll be spending a day out there next month. This stuff is really important. The other place where it shows up a lot is who gets the benefits of the clean energy transition. So that's sort of the definition for me, in my mind, a working definition of just transition. That we want to make sure that as opportunities for jobs are created, we have people benefiting from those opportunities across the board. I will talk a little bit more about workforce in a moment, but there's a huge need for workers right now at really every possible, from entry level to, folks with engineering degrees and beyond. So there's lots of opportunity, and we've been talking with our partners in the labor industry, and we've been talking with our Secretary Jones and Secretary Howe, who are over economic development and labor and workforce development, about how to make sure that these opportunities are broadly available. The other place is how do you spend the money? And one of the things we've been focused on, and this is no surprise during the campaign, then A.G. Healy emphasized the desire to explore a green bank and has tasked my office with making a recommendation on Monday about how we're going to do that, if we should do that, and what it's going to look like. So we've been spending an awful lot of time with that. And one of the things that we were very interested in, the whole idea of a green bank is you're sort of recycling the money. You get the money, you're lending it out, you get that money back again, you leverage other money. So places like the Connecticut Green Bank have a leverage ratio of like 7-to-1 right now, which means for every buck the state puts in, you're getting like $7 worth of clean energy development. All right, so it's a very good deal. We want to have something like that. And we want to make sure that we're doing something different with our bank. We don't want to be like other banks, which have really focused on clean energy investment as a way to grow the bank's balance sheet. Now, our bank has to have a healthy balance sheet, but the thing that we really want to focus on is decarbonizing the building sector for low and moderate income and affordable housing. Because I got to tell you, in Massachusetts is a little bit unique in that we own a bunch of our own affordable housing. Much of it was built in and around 1957. It does not have air conditioning. It does not have air conditioning. Much of it is in a floodplain. So this is an opportunity for us to go in, make the right steps, whether it's electrification, building envelope, efficiency, where we can reduce some of those resilience risks and have a real benefit for these communities and these people.
It's fantastic to hear that you're focusing on environmental justice, and one of the things we heard earlier today was from community health workers, and we are lucky to have in the audience community health workers from Springfield and working there with people that are affected by climate change and climate change associated events. And how will you be helping marginalized populations, communities that deal with these environmental justice issues, to help engage in policy making? What is the process by which your team will be engaging them?
So there's a key way that's coming up soon, which is that EPA has made available funding to all states. It's formula funding. It's not competitive. It's called the Carbon Pollution Reduction Grant. And it came in response to many states asking for additional funds to help them plan to be able to go after and receive the large amount of federal funds available through all agencies for this transition. So as a part of that, we'll be establishing stakeholder groups, and those stakeholder groups will be providing that specific type of policy advice to us. One of the stakeholder groups will be environmental justice and climate justice groups. So that's a very important way, and I think the other way is just having a very open door to hear from groups. And so when I mentioned the example of Longmeadow and Springfield, those are examples where when people are coming with an environmental justice issue, East Boston is another one. That decision was a decision that was made prior to the Healy administration coming in. But the community wanted a hearing on that, and we met with them. We offered to put a pause on proceedings so that we could review our legal options, and that is where that stands now. So it's an open door. We're probably not always going to have the answer that everybody wants, but it's very important to us to be engaging. The other thing that the Executive Office of Energy and Environmental Affairs has done is hire the very first Undersecretary for Environmental Justice. That's Maria Belen Power, who comes to us from Chelsea Green Space in East Boston, and 14 other environmental justice positions within EEA who are going to be helping to ensure that we're considering, and not just considering, but taking into account environmental justice viewpoints in our policymaking activities. Maria is actually coming out to Springfield with me next month. I want to just talk about youth here as well, because youth are also a group that are often not involved in the decisions that affect them. I know from meeting with clinical psychologist and psychiatric doctor from MGH recently that our youth are having a very difficult time for a variety of reasons, but also because they have a high degree of anxiety and depression about climate change. They don't think we have it. And one thing that we know can help is if they are engaged and if they feel like they are a part of working on a solution and working towards something. So we are very, very committed. I just started a Youth Climate Council, and we're just about to close the application period on that. And that will be an opportunity to meet regularly with youth to get their views on policy. Right now, I think their priority goal is to have legislation passed that requires climate education in K through 12 public schools, which is a really laudable goal. And I'm very much looking forward to working with them because frankly, their energy is contagious. And I am in awe of how poised and well informed they are about these issues. So that's just another place where we're really trying to engage.
Thank you. I can say it's really wonderful, and I'm very proud to be part of Massachusetts and to know the Healy administration has such ambitious goals in climate change and sustainability as well, and that you're engaging the youth and engaging marginalized populations. What I think some of the goals that you will be carrying out in terms of powering Massachusetts with 100% electricity that's clean by 2030 is fantastic. We've heard some of the hurdles that you've dealt with. What are some of the hurdles that we can perhaps help out with as an audience of academicians, of educators, of the public, and as well as of media? What do you think the next best steps are? And I'll let that be my last question, because I think we know that there are, we want to make sure there's time for some questions as well as time for Janet McCabe and her discussion. Thank you.
Thank you for that question. And I wanted to ask you all a question before I answer it, if you're comfortable. How many of you feel despair about climate? And how many of you feel rage about it? Who feels grief? And who feels optimism? All right. So a lot of us feel a mix of all of these responses to climate change. And I really appreciate this question because we need a sea change in how we talk about this issue. This is the first time in my career, I've been working in this space for almost 2 decades, where the conversation has really changed. I don't know if it's because the external signal of climate change is so clear, but it's very different now, and people can see what's happening. And I have found that events like this, leaders of institutions are willing to kind of come up to me afterwards and say, you know, things are not looking so good. We really need to X, Y, Z. And my invitation is, would you please say that publicly? Would you please join Governor Healy, who is willing to take bold action on climate, but she can't do it without the backing of institutions like this one and many others. This is really a time to think very differently about how we've done stuff in the past. What can we do? We know what we need to do. We have to stop using dirty fossil fuels. We need to do that yesterday. We need to stop investing in dirty fossil fuels. We need to stop investing in all of the institutions that support the development and production of these fuels, whether it's insurance companies or whatever. That's a big thing that we need to do right away. We need to change how we are operating our own institutions. I was talking a little bit about changing how government purchases things. We have to start baking in a social cost of carbon, however we do it. You know, for us, we're going to be looking at asking for people for their carbon disclosures consistent with what CDP wants. what their greenhouse gas emission reduction goals are, what their climate risk is. You got to start telling us that stuff. We might not make a decision on it right away, but we need to know. And all of our institutions need to be doing that as well. We have to get very serious about it because I am sorry to say, I think we all know this in here, knowing who this audience is. This isn't going to be, like switch out to an EV and, pop on the solar panels and we're done. We've lost our stable climate right now. The stable climate on which human civilization was built is now gone. So this is locked in. We all know the atmospheric residence time of carbon dioxide, and we need to deal with adaptation. So it's a time to really have frank conversations with each other. And I guess I would just ask you all in closing, my call to you would be to think about what would our world look like? What would our built environment look like? What would our communities look like? What would things look like if we really acknowledged that we are interconnected, that we are a species that relies on the thriving of other species and a healthy ecosystem? How would things be different? And then my call to you, especially the students here, go out here and make that world. Thank you.
Thank you. Thank you so much, Melissa. It was fantastic to hear from you. We really appreciate your time. We know you're busy, and we are excited to be busy with you and to make sure that we can accomplish those goals and to be part of the efforts of the Healy administration to generate new knowledge, to generate new curricula, and to be able to help shape these policies and study them. So thank you.
Thank you.
I'm now delighted to welcome to the stage my colleague, Dr. Tamara James Todd, who is the Mark and Catherine Winkler Associate Professor of Environmental Reproductive Epidemiology at the Harvard Chan School. Tamara? Great, thank you.
And I am delighted to invite Janet McCabe to join me today, the Deputy Director for the EPA. And I'm excited that we get to have a discussion this afternoon. I'm going to jump right in, if that's okay with you. Okay. So the EPA has been quite busy for the last couple of weeks. In just the last month or so, your agency has proposed requiring most new cars to be solely electric. You tightened pollution standards for heavy vehicles and imposed new limits on mercury releases from coal-fired plants. And I hear you're close to releasing new greenhouse gas emission standards for power plants. Assuming all these proposals are enacted and enforced, what impact will they have on climate change and on public health?
So first of all, thank you so much for having me. And it's great to follow my former colleague, Melissa. And wonderful that she's here in Massachusetts. Wonderful for me to be back here in Massachusetts. I'll just take one moment to share with you that I got started on my environmental career right here in Massachusetts at the Attorney General's office, which I think has graduated a number of us that are working in this field. And I had no idea that's what I wanted to do until I lucked into that job. So for students in here, you just never know which way your life may take you. I've got a couple of stories like that in my past. So this is an incredible time at EPA. I was at the EPA during the Obama administration, and I thought it was an incredible time then. And it was an incredible time then, but it is more incredible now. And I think that that is partly due to the administration that we have in place, the Biden-Harris administration. It is partly, and I think, in fact, significantly due to things that Melissa was talking about, which is just, if we thought we could not talk about this 6, 7, 8 years ago, we can't not talk about it anymore, right? More and more people from more and more parts of our economy, parts of our society are saying, we have just got to do something about this. So you have a lot of people that are pushing. So, of course, it is not just the EPA that is working on the president's climate agenda. It is every single agency across the federal government. And just as Melissa was saying, here in Massachusetts, you have a cabinet level position that oversees it, and a lot of what she's doing is working with other agencies. It's not her little office that's going to do all of this. It's all the other offices that are going to do all of this. So it's EPA, it's the Department of Energy, it's the Department of Transportation, it's the Department of the Interior, and it's agencies that you might not immediately spring to mind. Housing and Urban Development, right? Which is a huge, housing is a huge part of both the challenge and the solution here. So there's a lot going on. But you asked me about the EPA rules, so I am going to answer that. You mentioned a couple. My old Office of Air and Radiation, has been working on amazing transportation rules. Not only did we put out the truck rule that you mentioned in December, which will massively reduce traditional air pollutants from heavy-duty trucks, and along the way reduce a lot of climate pollution. We have a proposal out now for significant, the toughest ever climate rules for cars and trucks. Invite everybody's comment on them. They are ambitious, but we believe realistic, and will continue the transformation and accelerate the transformation to a zero carbon electric system. I believe those rules, I'm not very good with statistics, so I try not to rattle them off because I'll get them wrong. But the reductions from that rule are the equivalent of 2 entire years worth of carbon CO2 emissions from the country. So that's massively impactful. We are about very shortly to put out a proposal around fossil fire power plants. This comes on top of the Mercury rule that you mentioned, the Good Neighbor rule, which is also a significant power sector and now industrial sector rule that addresses pollution that crosses state boundaries, something of huge importance to the Commonwealth of Massachusetts, being at the end of the tailpipe at least for the eastern part of the country, as well as other things that are happening in the power sector. We also have oil and gas regulations. Methane, a more aggressive climate pollutant even than carbon, is substantially emitted through oil and natural gas development and use, all the way from getting it out of the ground to putting it into your stove and your furnace. And we have the most aggressive rules ever out for public comment. The comment period closed actually on those that we will be finalizing, which will take another huge bite out of it. When you put these kinds of rules together with the appliance standards that the Department of Energy is doing, with transportation rules, with rules from and decisions from FERC, with all of these things that are going on, those things all add up to meeting the president's commitment to reduce emissions 50 to 52% by 2030.
That's phenomenal, Janet. And one of the things that kind of comes to mind for me is there's a lot of changes happening at once across a lot of different sectors. And yet there may be a lot of backlash that might really kind of bubble up. And I'm curious how much you all are kind of thinking about and planning for that, level of kind of backlash, both from, the various sectors, but also from maybe those who stand to, lose on some of this.
Right. Well, nobody wants to spend years on rules that don't have an impact, right? I certainly don't. I've spent much of my life working on those sorts of things. And we live in a society where people are allowed to put forward their views. And often they are not in alignment with what any particular administration is thinking is the right thing to do. So of course we're very, very mindful of this, and there can be a lot of rhetoric. You may have heard it out there about whether the federal government is going way beyond its mandate, or is ignoring facts and science, or is influenced by this or that. And I just want to assure you that the EPA I have worked at has always put science, facts, and the law, and being transparent about what we're doing, absolutely at the forefront of what we do. And if we do that, then I feel good going into court, because you're right. I don't know that I've worked on a single thing at EPA that hasn't been challenged by somebody, right? It's just kind of the way our system works, and we don't even have Melissa Hoffer anymore in our Office of General Counsel to help us defend these rules. Fortunately, we have a very strong team there who's doing a great job as they weep for her not being there anymore. So I know it will happen, and we'll lose some cases, and hopefully we'll win a lot of cases because we're doing the right thing here. But we'll keep moving forward, and if it turns out that somebody thinks we should have done it a different way, we'll go back and fix it and do it another way, and try to bring people in as much as possible. But I'll tell you that even with all the rhetoric and the backlash, industry more and more we hear them saying, yeah, these are the right things to do, and we're doing them ourselves in our own corporate policy, in the way we make decisions, and how can we work on this together? And we always welcome that. Truly, I mean, you can't develop effective regulations if you're not talking with the industry that is going to be regulated, because it just won't work. So all those things come together, and we try to move forward and continue to evolve in those relationships, in improving the transparency that we can use, in improving the way people can get information to us. One last thing I'll say, and I'm sorry I go on too long in these answers, but is that one of the really important things for President Biden is that people who have not had a voice in policymaking traditionally have a voice in policymaking. And that is a powerful constituency to start bringing, not just we think you should do X or Y, but this is the way it is in my community. This is what it looks like. This is what the water in my backyard looks like. This is how many times my basement floods. This is how often my kid can't go to the playground because of too much air pollution. And those are facts. Those are people's lived experience, and they are valid for purposes of the things that we should be taking into account.
That was the perfect segue. We started off today's discussion around kind of this is climate change is personal. And so being able to hear those stories and voices that is equally as powerful as when we talk about kind of the big picture. And so just along those lines, President Biden has committed to what he calls the most ambitious environmental justice agenda ever undertaken by the federal government. Part of that is the Justice 40 initiative, which aims to steer at least 40% of all federal spending on climate change to disadvantaged communities. So out of curiosity, how is that going? And can you tell us about a few of the projects you're particularly excited about?
Yeah, well, thank you for asking about that. And I think Melissa mentioned Justice 42. What an amazing way for a president to focus people's attention on the fact that investments in this country have not been fairly distributed. And for EPA, we actually, over the years, have, I don't know what the numbers would be, right? But so many of our programs are focused on areas where communities are overburdened by pollution and have been for many, many years. That for some of our programs, 40%, come on, we're at 80, 90%, right? Our brownfields program, our job training programs, the Superfund program, a lot of those programs are naturally focused on those communities. But if you think about other agencies that maybe haven't had environmental justice so much in their purview, this is really causing them to think about that. So to answer your question, we are doing very well on Justice 40. It is making even those programs that are already naturally focused in that direction much more intentional about it, and very proud of the fact that they're overachieving. And some of our other programs where it can be harder to quantify, it's causing us to think about it. So if you if you pass a regulation that addresses cement plants nationwide, for example, there's some cement plants everywhere. How do you figure out if the benefits of that rule, how they're benefiting low income and underserved communities? And it's important for us to do that. So we're working on all of those kinds of things. And I know we'll get to some of this in some of your later questions. There's lots of other things besides Justice 40 that EPA is doing around environmental justice and equity.
Are there some projects that you're particularly excited about?
Well, you know, I have to say, so in the job that I'm in now, I get to dip into a lot of the programs, and one of the most fun things I get to do is attend graduation ceremonies at job training programs. And if you've never gotten to go to one, oh my gosh, it's just great. I went to one in Chicago, and it was like the happiest, rowdiest high school, college graduation you could ever want to go to. And I talked to one person, people from all ages, different backgrounds going through these programs. And I said to one guy, I said, what are you going to do now that you have all this training? And he said, I'm going to start my environmental career. You know, they're being trained for careers in service to their communities with really important skills that are not just important in this moment, but and it's so great that you put me right after Melissa, because I get to just point to so many things she said. Going into the future, our yards are going to be flooding more. Our sensibility about pollution in our neighborhoods is going to be higher and higher and higher. And so having these skills makes these people really valuable members of their community, and they're so proud. So when I think about really joyous things, I think about that. Now, I'll tell you about another one that's not so joyous. You may have heard of Lowndes County, Alabama. Anybody heard of Lowndes County? I know Melissa has. Not too many people have heard of Lowndes County, Alabama. So Lowndes County, Alabama, very high majority, people of color, long-time community with basically no indoor plumbing for many, many of the people. These are American citizens, tax-paying people who've lived in these communities for years, and they have what are called straight pipes, taking the sewage from their house into their yard or into the nearby creek. And Lowndes County is not the only place in this country where this happens, but it's a really egregious example of it. And the administrator went down and visited Lowndes County. There's a champion down there. Her name is Catherine Flowers. She's amazing. She's a MacArthur. She won one of those MacArthur Genius Award things for her work there. Places like Lowndes County spurred a program where EPA is working with the U.S. Department of Agriculture. We've identified about a dozen communities like Lowndes County around the country where we're going to make that not be the case anymore. And think how transformative that is for the people in that community. If you Google this, you'll find photos of the administrator standing with families and seeing where the kids play around these straight pipes. It just breaks your heart. And so to be able, as a federal government, to come in and make a difference there is a phenomenal opportunity.
I think you raise an important question that connects specifically to this initiative. So the administration has explicitly considering racial demographics when assessing whether or not a community is disadvantaged or not. And there's been some pushback on that, that in fact may undermine environmental justice issues. And I'm just curious, have these discussions come up, and what might the response be around that?
Yeah, these discussions do come up, and I think they're important discussions to have. I think the president has been very clear with his marching orders to the agencies that we are to focus on communities that have been disadvantaged and bear an unfair burden of air, water, and land pollution and risk to climate vulnerabilities. And we are to focus on those communities, and that's what we're doing. And we work with those communities all across the country whoever lives there. And that's really, really important. One of the first things that Administrator Regan said he wanted to do when he took office was to create within the EPA an Office of Environmental Justice and External Civil Rights. So for many people, the idea of, oh, you're making an organizational change within EPA, okay, fine, go ahead, do that. But it is incredibly impactful when you work within a bureaucracy, because bureaucracies operate based on organization. And so what he was saying is, our environmental justice, EPA has been working on environmental justice for decades and decades, right? But it was a small office. It kind of moved around from place to place. It didn't have its own statutory mandate. It had to scrabble for a budget from the offices like the Air Office and the Water Office that have Clean Air Act and Clean Water Act and these very clear mandates and lots of money coming in to fulfill those mandates. What he was saying is, we need to have an office on par with the offices of air, water, and land that is focused on environmental justice and external civil rights. Put those two functions together that had been separated and give them a leader who is going to be a peer of the heads of the air, water, land, et cetera, offices. And that is transformational, and we have gotten that done. And so that is now part of EPA's organizational structure, and it's having a cascading effect because the regional offices around the country, and David Cash is here today, who runs our New England office, they are also setting up offices to focus on environmental justice and civil rights that are on par, on a peer level in the organization to air, water, land. So, this is something that will last organizationally, and it is changing the way people think about and internalize the need for focus on environmental justice, so that we look at it in everything we do. It's exactly what Melissa was saying. So you have the person in Massachusetts who's in charge of buying insulation for the prisons. And that person may not have thought about, that's an environmental justice issue right there, by the way, as well as a climate issue. And that person may not have thought about this. But now the expectation is that that person will think about it too. And that's what is happening in EPA because of this focus on an elevation of environmental justice and just making sure that it's as important as everything else. If I could add one other thing, this gives me such a nice opportunity to talk about the amazing things that this administration is creating that I think will have lasting effect. So many of you may know that the first administrator of the EPA and the third administrator of the EPA was William Ruckelshaus, great American hero, right? Known by many people more for his role in the Watergate situation than at EPA. But he was EPA's first administrator, and then he came back in after an administration of incredible turmoil where at least one person went to prison as a result of it. And he issued something called the Fishbowl Memo, which is notorious at EPA in a good way. And he said EPA should do three things: follow the science, follow the law, and be transparent. And if we do those three things, we will be doing our job for the American people. And you heard me refer to those three things before. Well, Administrator Regan has now added a fourth pillar, which is equity. Seek equity. And that, again, is a transformative and I believe will be a long-lasting legacy of this administration when it comes to making sure that everybody in this country, whatever their color, enjoys public health, quality of life, and a thriving economy.
I really love that point. And I think one of the questions I want to kind of follow up that point with is really, regardless of what happens in 2024, how can we continue to make sure that equity is a part of this conversation, both around, environmental justice and more specifically around climate action?
Yeah, I think we're beyond it not being part of the conversation. I think there are too many people who are feeling it themselves now. Too much has happened in this country for most people to ignore both of these things. equity, and what's happening with the climate for us ever to turn back. And I think the folks who are out there, wherever they are, however they get a platform, who poo-poo climate change as an important issue, who do not support the notion that there should be fairness around environmental, climate, public health issues around this country are becoming more and more isolated and more not taken seriously, which isn't to say that there won't continue to be those voices. I'm sure that there will continue to be those voices. But I just think they're less and less relevant as we move forward. And the more flooding there is, the more wildfires there are, sorry to say, the more drought there is, the more food prices go up, the more supply chain issues there are, the more everybody will realize that we have to be thinking about this. Any responsible corporate leader today, if I'm the head of whatever, I'm not going to name a company because that wouldn't be good, but X corporation, right? They're not just thinking about today, they're thinking about the future of their company. They're thinking about their employees, the responsibility they have for their employees and the communities they operate in. They're thinking about, any food service company is thinking about, am I going to have a product 20 years from now? How are we going to make bread and cereal and all of these things in the future? And so it's the responsibility is on them to be thinking about these things too. So I just don't think we're going to go back.
You know, we're sitting here with an audience full of public health practitioners.
I know, I love it.
You know, one of the key things that we really focus on is that climate, change is indeed a public health issue. I'm curious, what do you think about that link? And then how would you recommend we do a better job of really communicating that point?
I think that's such an important question. So I came up in the environmental world through the Clean Air Act and doing air quality work. And I think there's no way to avoid the environment and public health link when you work on the air quality side, because that's what it's all about. Well, there's acid rain, which kills forests, and that's critically important too. But really, we focus on the way air pollution affects people's lungs and their health. Climate change is a public health issue. There's no doubt about it. One thing that EPA just did recently was we just put out a report on climate change and children's health, which is really important. And you can sort of internalize, oh yeah, right, children, very important, but where's the research? Where is the cost-benefit analysis? Where are all the things that people look to support regulatory and policy action when you're trying to make a case about the effects of climate change on children's health in the future? We don't have enough of it, so we need more of it. To get to your question about communication, I think that reports like this can be really helpful. I spent a number of years in the nonprofit sector, and I applied for grants. I've been on the other side of this. And reports like that from EPA were things that I used in order to justify the requests that I was making for funds. So it's a two-way street here. I want to, as they say in some circles, foot stomp Melissa's, I didn't know that phrase until a couple of years ago. I kind of like it. Foot stomp what Melissa said about speaking up. Everybody needs to speak up. And I think increasingly we're seeing that. Boston is a big city. Lots of us live in small communities or smaller communities. They want letters from their readers. They want content to put out. They love to get local people speaking out about issues that matter to them. So there are opportunities there. There are opportunities at conferences like this. There are opportunities wherever you encounter people in your life to make sure you're talking about these things. I think making the connection between climate change, which can be kind of abstract and science-y, to to people's lives makes a difference. And if it's difficult to have a conversation, everybody's a scientist on some level. Boy, you know, I had to water my tomatoes a lot more last summer. What about you, right? Or I remember hearing about getting an email from a woman in Alaska who said, I just saw a hummingbird outside my kitchen window in Anchorage. We don't have hummingbirds in Alaska. Right? These are personal observations and experiences that can really bring home to people things are quite different now and getting differenter. And I had another really wise point that I've totally forgotten. So perhaps I will remember it in a minute.
Well, I'm just going to close us out. I have a final question. And Melissa, I really do appreciate that you surveyed the audience on this and in thinking about, you know, not feeling hopeless, but rather being able to be optimistic. I'm curious for the many students and trainees that we have in this room, what advice would you give them? You know, if they're interested in pursuing careers in this space, they really are our hope for the next generation, for the future, but also for ourselves to stay hopeful as mentors, as folks who are practicing and doing this work right now. Are there kind of a closing set of thoughts on really being able to pursue and stay in this and be optimistic as we continue the way forward?
I think it's so important to be optimistic. And Melissa, I'm glad you asked that question at the end, because I think I hope that's the way most people feel. And if you don't, you should talk to somebody. But you have an opportunity, if you are just coming up now and this is something that you're interested in, you have more opportunities than you've ever had before as a way to get engaged and make a difference. There are needs at every aspect of society for people to focus on this. So for example, if you really love the world of insulation and that's what you want to do, you want to be a building HVAC person, which has got to be one of the hardest jobs ever, right? Because nobody's ever happy. They're either too hot or too cold. But there's a part of that job now that is a climate job where you can make a difference. I say this when I talk to people about coming to EPA now. You're an accountant, great, we need you. You are a communications person, we really need you. You are a technology person, we super need you. You're a big data person, come to EPA, there's a job for you. And all of those jobs have as their mission protecting human health and the environment and dealing with climate change and bringing equity to this country. So, and in the private sector, there are so many opportunities. I spent time at Indiana University. I spent a lot of time with undergrads and master's students at the O'Neill School of Public Policy and the Environment, one of the top ranked master's programs in the country. And those students, most of them do want to work at EPA, I will say that, but a lot of them go into the private sector and they take all of their knowledge and understanding and perspectives and they take their hometowns to those jobs in the private sector as well. And that is really, really, really exciting. Another thing, just as a personal note, somebody asked me at a program a while back what I did to stay motivated and optimistic. And I said, only half in jest, I eat one Oreo every night. So I say that because you have to take care of yourself too. And pay attention to, don't let yourself get overwhelmed. Either with grief, despair, anger, or just by working so hard that you can't see straight and can't be there for your family and for yourself. So have that Oreo every day. This is not an advertisement for Oreos. Whatever cookie floats your boat, or a carrot or something. So
thank you so much.
Thank you, Tamara. Thank you, Janet. We'll return back here after a bio break at around 4:05. We need to start our next wonderful panel on infectious diseases and climate change And if people don't mind, if Janet and Tamara and Melissa and David, if you can stay, and Dean Williams, if you don't mind coming up, we'll take a photo. Thank you so much. And is Dr. Fortune here in the audience, and Dr. Ivers? Thank you. Come on down. Thank you.
Thank you so much. That was so fun. Wonderful. Thank you.
So I just want to point something out before we start, which is you've got the
First,
three of
a
you
little
who actually
problems,
know what
right?
you're talking about.
Cross-border migration, my name.
I should be over here.
Nope, 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 not at all.
Not happening. Too late for that shit.
Too late, too late.
Hi.
How are you?
Fancy seeing you here.
How weird.
I was just acknowledging the fact that
Okay.
things are more silly on
Thank you, everyone, for coming back. Thanks to everyone for coming back. It's great to see you. That was a terrific conversation, and while our government administrators are leaving the room, let's give them a warm round of applause. Thank you, David Kosh and Melissa and Janet. We next want to start a really wonderful, engaging conversation with our infectious disease colleagues on the link between climate change and infectious diseases and how to confront that and how to address it. And I'm pleased to introduce our moderator, Dr. Sarah Fortune, who chairs the Immunology and Infectious Disease Department at the Harvard Chan School, and our illustrious panel. So thank you.
So Kari, thank you. Thank you everyone for joining us, and thank you to my wonderful panelists. I'm going to start by introducing the panel, and I'm going to start with Ari Bernstein. Ari's title is about 4 lines long, so I have to read this. So Ari is the interim director of the Center for Climate Health and the Global Environment at the Harvard Chan School, and soon to be director of the National Center for Environmental Health and Agency for Toxic Substances and Disease Registry at the CDC. So Ari, welcome. Caroline, whose title is blessedly shorter, is the professor of epidemiology at the Harvard Chan School. And Marcia, who is the chair of the Department of Global Health and Population and the Andalot Professor of Demography at the Chan School. So welcome to all of you. Thank you so much. So we're going to talk about climate and infectious diseases today. And we're going to do this in the same rhythm that has governed the previous panels. We'll start with the discussion of the problem, and then we'll move to solutions, and then we are going to save plenty of time for questions, so just tee up your questions. So to give you a sense of the problem, and as much as you need more of a sense of a problem after today, we're going to start with a video here. So if you could roll the video. So this is an animation from NASA, which illustrates the impact that climate is already having on our planet. And I realize I can't actually see the video. So
that's the mean surface temperature. It started in 1880 and will go until 2022. So.
Okay, so that is a sobering picture of our reality. So the bottom line is the Earth has warmed an average of 1.1 degrees Celsius since the Industrial Revolution, and you've heard of the global target of 1.5 degrees Celsius, and it is now likely that we will blow past that target in the next decade or so, although I have to say I'm a little bit heartened by our previous discussants from the EPA. But with this dramatic change in temperature has obviously come impact on many different aspects of health, including infectious diseases. And Ari, it is up to you to sort of scope that problem for us.
No problem. So thank you, Sarah, for moderating. And I want to thank Dean Williams for organizing this event. I think it's noteworthy that in this Climate Week, the Chan School stepped forward and put together what I think has been an extraordinary afternoon focusing on issues that are very personal and critical to moving us forward on climate action. And so I'm delighted by the turnout we have, and the speakers today have been extraordinary. Interestingly, if you look back at human understanding of climate change in the health sphere, infectious disease was sort of first out the door. And I find that interesting in a number of ways. Going back 30, 40 years, many of the first papers are like, it's getting warmer, we think insects are going to move somewhere, that seems like it could be a problem. and I want to say what's interesting, and you've got two people who really understand what they're talking about in terms of infectious disease next to me, so I'm going to be circumspect, or more circumspect than I might otherwise. But the reality is, when it comes to things that fly like mosquitoes, figuring out what climate change means ain't so easy. Now, that said, we definitely have seen climate signals. So anyone here worried about Lyme disease lately? Yeah. So Lyme disease is in Canada. The ticks that transmit Lyme disease are in Canada. It's pretty clear that they weren't there before, and it's pretty clear that that was because it got warmer. Now, many people say it's hard to tease out the human influence, right? So are we changing the forest ecology to make ticks present, or are we changing habitats? Are we? And that is one of the big challenges that makes the crystal ball, as I like to call it, of climate change and vector-borne disease hard to see through. But we have animal systems. So there's malaria in people, there's malaria in birds. And there's very good evidence that in places like Hawaii, birds have become endangered and gone and potentially extinct from avian malaria moving up mountainsides, which there are studies that are strongly suggestive that we have seen or are seeing in real time malaria moving up mountainsides in East African highlands, in Andean countries, and like. But when it turns out to the interface of climate infectious disease, I actually don't think as much about the vector-borne disease, although there's a lot to think about there. I think about diseases transmitted by water. Turns out that a lot of people in this country get water from wells, and when it rains a lot, which it's definitely doing in many places, or doesn't rain enough, you can get outbreaks of waterborne disease. That's true globally, so I think a lot about waterborne diseases. And I think about what many people call as indirect pathways. So I'm a pediatrician, right? Under 5 mortality in the world, heavily determined by diarrheal disease, right? So a large number of young children in the world are still dying from totally preventable diarrheal outbreaks. Now, why do they die? Well, they get infected, but their nutritional status is often lacking, and a big part of that is their vitamin A sufficiency. Turns out, and this is work of people like Sam Myers and others, if you juice our planet with carbon dioxide, the plants that feed us, and particularly mainstay plants that we really rely upon, guess what? They make less vitamin A. So in many ways, the infectious disease risks I think about are not the immediately apparent ones that were in people's eyes 30 or 40 years ago, like vector-borne disease. Really waterborne diseases and these indirect pathways, whether it's through CO2, through population migrations. We heard a lot about that earlier. It's very hard to deal with infectious disease outbreaks in places like refugee camps. We've seen this already, and the like. So that's maybe as short as I can, overview of the window into climate and infectious diseases.
Perfect. So, Marcia and Caroline, I'm now going to ask each of you to give me an example of what's top of mind for you as you think about the nexus of climate and infectious disease. And Marcia, I'm going to start with you.
Yeah, so I'm going to give one example of how some environmental changes that are happening now also contribute to the transmission of infectious diseases, but also to climate. So if we take deforestation in the Amazon biome, for example, from an infectious disease perspective, there are 2 aspects. First, the deforestation process is directly connected to an increase in transmission of malaria. And this is documented. That's not a hypothesis. That's highly documented. But also, as deforestation happens, humans get closer to this huge reservoir of viruses that are in the forest in different kinds of animal species. And the possibility of a new zoonosis emerging is also very high. In fact, I think we lucked out that nothing has emerged and created a problem so far. From a point of view of climate, deforestation produces less rainfall. And in fact, if you take the entire southern portion of the Brazilian Amazon, known as the Arch of Deforestation, it's already receiving less rainfall. So the drier season is longer by about a month on average. And by speeding up this process, then we can have all the things that Ari just mentioned. So if you take deforestation as one example, it increases the transmission of diseases right now. It can facilitate the emergence of new zoonoses, and it speeds up the process of climate change that in itself can also lead to more transmission. So no matter from which angle you look, it's a bad thing.
Okay, and just my job here is going to be to just provide the dictionary aspect of this. So the arboviruses are things like dengue, chikungunya, Zika, things you hear about all the time. Those are that set of zoonotic, arboviral diseases that are being pushed into human populations.
And many others. We
And
don't
many
even know.
others, yeah. Caroline.
So I guess building on what Marcia was saying, I think a lot about livelihoods, and there are also plant pathogens that we can't forget that are very important for farms and agricultural systems. And when we think about what happens when we have either extreme weather events or shifts in seasonality, if you're already living on the edge of poverty, then often that means that you have to leave the land. So when we think about climate migration, which is something I think about a lot, it's not just climate refugees, which is a huge problem for sure. It's also disruptions to seasonal labor migrants and the increasing rural to urban migration that we see as a result of changing patterns of the feasibility of different agricultural systems. And what that does is it not only connects us even more through mobility patterns, it also pushes people into urban and peri-urban environments where we have very high density of population. And so if you were going to design a perfect system upon which to spread a pandemic, you would put everybody in very close proximity in cities, and then you would connect them by global travel as much as you can. And that's exactly what we have. And in fact, we're now seeing that problem exacerbated. So it's exacerbated by climate, as Marcia pointed out, because we have people in closer proximity with environments where we have a huge diversity of potentially zoonotic emergence events. We've created a system that is not only driven by climate, it's also setting us up for increasing and worse pandemics. So that's something I think about a lot.
And Ari, do you want to add to that, sort of painting that picture beyond the landscape? Do you have more specific examples you'd like us to think about?
Well, one thing I would point out, and it's always great being with Marcia and Caroline because I'm learning something new every time. At this juncture, and having heard everything we've heard today, I think it's really apparent how critical it is we start to think about multi-solving, right? So deforestation, big problem for climate change, right? So maybe 20% of all emissions are coming from chopping down forests. Also a big problem for emerging infectious diseases. But when we think about the value of protecting forests, I can tell you that in policy debates, we're typically only talking about them as like literally carbon vacuums. I don't even know if we get to the deforestation as infectious disease risk. But the point is that we really need to think about intersectionality in the environmental movement. And I think we've seen that. A lot of the conversation has been focused on youth influence. That is clearly an influence of people who are a lot younger and smarter than me, having an influence for the better. And I think the good news is that we can actually do things that provide huge benefits, both to potentially infectious disease risk and also to climate.
Yeah, actually, so we had a prep session in anticipation of this panel. We are doing this entirely spontaneously. No script here. No, and actually this leads really to one of the points that Marcia made in the prep session. And do you want to expand on what Ari was discussing in terms of deforestation and the complexity both of deforestation but solutions that have emerged?
Yeah, so there's a lot that can be done with regulation. And we know, again, that there's plenty of data showing that the indigenous territories in the Amazon are the most preserved and are the ones that really contribute by about 27% in absorbing PM 2.5 in the forest. Having new lands in the Amazon demarcated as indigenous territories is a big step forward in preventing areas from being deforested. By law, there is nothing like deforestation, mining, logging that should happen in those areas. And you can see in some satellite images, you can almost see where the boundaries are. However, and I mentioned legislation is not enough, and what we've seen in the last 4 years in Brazil is that those areas have been invaded by miners, and I think everything really exploded end of January with a humanitarian crisis among the Yanomami that we had malaria, undernutrition, diarrhea, violence, and several diseases associated to mercury contamination. So it's way more than just the role of diseases we mentioned here. There is a study published last week mentioning that if we actually preserve the indigenous territories, we can save about 15 million cases of respiratory diseases and cardiovascular diseases, and save about $2 million from the health system just by protecting this. And we published a study last week showing that although indigenous lands have very little fires, they're not the ones producing the fires, they have twice the risk of having mortality because of exposure to the smoke. So regulation is necessary, but it's not sufficient. We need measures of accountability. We need measures of enforcement so people that actually violate those laws can be held accountable. And then, there's not a message, as we had in the past 4 years, go there and nothing is going to happen if you just cut down the trees.
And actually, can you say just a little bit more about measures of accountability and enforcement? At what level are those most effective?
Yeah, so in 2004, I think it was the peak of deforestation in Brazil. It was completely out of control. Then that's the first term of President Lula. And then they had several measures, first in protecting land. And again, now there have been already 3 indigenous lands that have been demarcated, none in the past government. In fact, some were removed in the past government. So legislation is one, but there were an entire network of surveillance that was put together on the Amazon, and people were actually, they had to pay fines, they were being held accountable. There was the entire satellite system that put together. Now we have daily alerts of deforestation. Every single day we know where things are happening, but knowing is not enough. You have to take action. So we had about 10 years of those things really happening in an effective way, and it was the most drastic decline in deforestation. In the past 4 years, everything reversed. And how did this happen? So a lot of the legislation was relaxed. A major legislation we had in the past, the Senate is trying to reverse this now, but they basically said every single indigenous land that has not been demarcated until 88, that's the year of the Constitution, they're going to lose it. I mean, they were the owners of everything. So, so pretty much every step forward that were made in terms of holding people accountable in piece of legislation in the past 4 years were put down. So it's going to take some time to bring those back, but,
So I'm going to go a little off script here, because actually what you just said about data and as being important in terms of holding governments, holding us all accountable, seems resonant to actually, Caroline, a lot of your work. And I was wondering if you wanted to expand on that, sort of the importance of data.
Sure. I'm happy to do that. So I work a lot in infectious disease surveillance, and I work with control programs a lot to try and identify hotspots of transmission for resource allocation questions. What I would say is that on this topic, we have massive data gaps. And not just that we're not collecting data in a way that's integrated into health systems, which would be a first step, right? Environmental data and health system data in one place so that we can start to ask some of these questions. But I also think the types of data that we have available reflect certain global priorities that may not be local and regional priorities. So we may not be going after the right thing. And I also think there's a major problem with mechanistic data. So at the moment, we have a lot of beautiful maps, and we have a lot of associations, for example, between the length of time it takes a parasite to develop in a mosquito at different temperatures. And so what often happens is we get beautiful models where we take that sometimes nonlinear relationship, we tack it onto a beautiful map like this, and we get a projection of where we think dengue risk is going to be in 30 years or something like this. Those maps are useful for advocacy, but they are not useful data for control programs, and they're not mechanistic in the sense that we don't understand many of the social aspect, the economic drivers. These are not multidisciplinary efforts. And so I think there are two types of gaps on the data in terms of what we need to do. The first is that we need to start collecting environmental data as a matter of course within our health systems. And the second is we need to start building up mechanistic relationships in the context of some of the behavioral and social realities in places most affected. And that's still a huge gap.
So Ari, the other sort of data we have is our own learnings, and we just went through a pandemic. Is there anything that we can take from our response to COVID, done well or done badly, that we can now apply as we move forward?
We've got how much time?
You have about 3 lines.
I've got 3 lines, right. So I think one of the things that I was particularly impressed by, and this is to the faculty at the Chan School, was the pivoting on a dime to address this global health crisis, right? So you saw people of all backgrounds trying to figure out how we as a scholarly community could contribute. And I only got 3 lines, but one of the things that I think really spoke loudly to me was work of Francesca Dominici, who is here and may still be here, and her team, that underscored that when we think about air quality improvements, we tend to think about lungs, which is important. We think about mortality, so we know from the 6 Cities study that, among others, that air pollution is really bad for people living to their expected age. But it also turns out that even small amounts of difference in the air we breathe over a decade can have profound impacts on whether people lived or died from the pandemic. And that is a huge environmental justice piece. And so when we heard from EPA about these rules, when they talk about these benefits, whether it's from the mercury rule or the fuel economy rules, the air pollution rules from trucks, we haven't even included those yet. And so I think it's extraordinary that from this disaster, we can see the greater benefits of these actions we're doing on climate, particularly from an environmental justice standpoint. And I think that was one point that struck with me.
I'm going to take this moment to just take a brief time here and clarify my timing instructions, because and I have 10 minutes until the 20 minutes. Got it. So yeah, I thought I only had 10 minutes left, and I was like, oh, there's something disastrously wrong. Okay, so actually, but with this little interlude, I just want to say we have about 10 minutes more conversation here. Cue your questions up. This is actually, I think all of the issues that we're discussing are reflective of the themes that you've heard through the day, and this would be a great time to have a broader conversation. So, okay. So I was wondering, actually, I wanted to come back to this question of equity and climate equity and infectious diseases. And Caroline, you've touched on this, so it's not just domestically, it's globally. And I was wondering if you could expound on the problems of migration and how that's going to, forced migration, and how that plays out, and whether you see any innovative solutions to what seems to be an intractable problem.
So I think when we talk about inequality, there's so many axes that we can talk about. There's, of course, large global inequalities between countries, and we saw that play out both in mortality, but also vaccine allocation, and the frankly immoral distribution of vaccines around the world to different countries. And in the context of these intersecting health risks. So the problem with the climate and health intersection is that if you are already vulnerable, then any stress on the system is going to make you even more so, which we know from many different crises. But what it means on a global scale is that we have, like if you look at South Asia, we have millions and millions of people who are already affected and have been dealing with extreme weather events and gradual increases in temperature for a long time, who are going to be the ones, they're already feeling the effects now, and that will get worse into the future. And in terms of the mobility data that my group works on and some of the migration issues that we've seen, that has certainly been getting worse over time. With regards to solutions, I think we here in the global north have a lot to learn from our partners in the global south who have already been facing some of these challenges. If you look at Bangladesh, they do a great job of responding to cyclones because they've been dealing with it for many years. And I think we will continue to see innovation from our global south partners when it comes to some of the challenges of heat adaptation, figuring out how to respond in the wake of natural disasters. And so I think meaningful academic partnerships that reflect where climate change is having the most impact, which populations are most affected, and really trying to understand and listen to some of the researchers there on the ground is going to help us not just prioritize, but also come up with some of the innovations that we need. Because I think if you look at what happened with COVID, the same epidemic was not the same in different communities in terms of mortality, in terms of response, and in terms of how policies were enforced. And so I hope that in the wake of the pandemic, we will have a kind of reimagination of global health partnerships in the context of the climate emergency as well. So I've given you no solutions, but I think the way forward has to be a kind of major global effort to think in an integrated way about some of these challenges and not assume that we know people's realities.
No solutions, but you did actually remind me of something Marcia was discussing in the prep session and around solutions that have come from the indigenous communities. And Marcia, I was wondering if you wanted to.
Yeah,
about
so
that.
again, in the context of the Brazilian Amazon, a lot of the problems we see now in terms of equity really come from a predatory model of the so-called development that is just based on exploitation of resources, ignoring local people, their culture, their knowledge, their needs, everything. So to me, if we really want to address equity, it really starts from listening, understanding, and working together. So anyone that comes here and say they have the solutions for the Amazon and they've never been in the Amazon and they don't practice the listening, understanding, and working together, it's wrong from the get-go. So we have, thanks to a program that was put together when President Lula was president the other term, a lot of energetic and really bright young indigenous leaders made it to the university, and they are now really leading their communities in fighting for their rights, in improving education, in improving community health. They use drones to fight for environmental justice. And we recently, now in this new term of President Lula, for the first time ever in our history, our meaning in Brazil, we have a minister of the indigenous peoples. So this is an incredible opportunity to give voice to the unheard. And that's how you address equity. It's bringing those people to the table, sharing their knowledge. They have solutions we never thought about. And I think this is one of the clear examples of if there's a will, there's a way. Where I think we're finding a way, and we hope we can continue on this path to address some of the issues on equity that we have.
Okay, so this is the time when people who have questions should start making their way around. And Ari, yes?
Well, I was thinking if I can get one more shot at the
Please,
solutions piece,
yes.
because we
Oh,
need
God,
solutions.
yes.
So I was listening to Marcia and Caroline, and I think for many of us, there's an unprecedented awareness to the divergent paths of the richer countries in the world and the low and middle income countries of the world that the pandemic showed us. I mean, pandemics show us in the most painful way what we need to fix in the world. And in the aftermath, I think one of the things that many of us realized is that our foundational approach to dealing with infectious disease, and I'm mindful I'm going to the CDC, so be careful here, is frankly a reactionary approach. It's let's wait for people to get sick and then try and fix it after the fact with tests, drugs, vaccines. Now, we're always going to need that. There are always going to be infectious outbreaks. I mean, for heaven's sakes, we have this huge population. We're interconnected. I like to think of that as sort of the lighter fuel of global pandemic risk. But the kindling for it is actually how we're doing business with nature. If you look at most of, and certainly the pandemics, but most of the major emerging infectious disease risks, they're coming from other animals, sometimes livestock, sometimes wild animals. And we have enormous opportunities to prevent the movement of those diseases into people. We do it to a certain extent now, But when we looked at how much we're investing in what I would call these primary prevention strategies, so I'm a pediatrician, right? So pediatricians, we're all about preventing people from getting sick. And most of the people I talk to, we tend to like to just not get the cancer first, not get treated for the cancer, not get the heart attack, I think all of us prefer to just not have as many of these emerging infections from things spilling from animals into people. And when we look at this, it is the best buy on the planet, especially when you look at the reality that some of these strategies involve conservation of nature potentially. So the other thing we always got critiqued about in this work was, well, how do you know this stuff's going to work? And I said, I don't know that we do, because we don't have the data we need. We don't have the track records. There's more paradigms, but they're very small. But then we said, well, how ineffective can these things be to still make them cost effective? And they can be radically ineffective. Why? Because the value of doing these things creates benefits to health equity. So think about this, folks. Most of the emerging infectious disease crises happen in low and middle income countries. The resources that get deployed are in rich countries. So whether it's the vaccines, the tests, the drugs that aren't getting there like need to, the profits are going to rich countries and their corporations. The damages are greatest in low and wealth countries. But when you prevent at the source, when you stop these events from happening in the first place, the benefits accrue greatest in these communities. So there's work from Matt Bonds, who's at HMS, and Andy Dobson looking at data out of Rwanda, where they show this fascinating interplay between infectious disease burden, economic development, which is nothing new. That's been known for a long time, that infectious disease burdens create poverty traps, but the ecological substrate of the community. So there's this interplay. If you are poor, what are you going to do? You're going to rely more on nature. Chris Golden's work, Chris was here, his work in Madagascar has shown this. The people who are most at risk in many places for iron deficiency anemia in Madagascar, they need to have wild animals to provide food. And if you take that away from them, they're likely to have nutritional deficiencies. So we see this globally. So you have infectious disease burdens, that drives poverty, it drives greater destruction of nature, and what happens when you destroy nature? You risk having more infectious disease outbreaks. So the point here is you can get a win for equity, a win for climate, and you can protect communities that are where these diseases tend to erupt.
Fabulous. I just am so mindful that people haven't had time to have questions, and so it's all you.
Hi, my name is Erika Arteaga, and I am from Ecuador. And it's great to be here, but also I was telling people that in climate change you need to have hope, and I'm totally here disheartened because my country is living a huge violent wage with narco traffic and narco drug dealers. So my question is regarding prevention in low-income countries, middle-income countries, and Brazil. I'm just gonna quote an Uruguayan journalist. His name is Raul Sibeki, and Raul Sibeki wrote something regarding Peru. I'm tackling all the region because I think narco traffic and narco warlords are a problem of Latin America, and I'm gonna tell you the link between climate change. So Raul Sibeki was interviewing Rocio Silva Santiesteban, a former congressman, a leftist and human rights activist. And she said that an emerging bourgeoisie that is anchored in the illegal economy, often linked to drug trafficking, and that has its representatives in all parties from the extreme right to the host of the post Pedro Castillo. This neo-bourgeois sector rejects the legal rules, but embeds itself in the power apparatus because it needs to have a protective umbrella for its business and interest. Then he goes on and saying 27% of all imported mercury goes to illegal mining from Peru and Bolivia. A trade that follows the Amazon route from Puerto Rico, Puerto Maldonado to Lake Titicaca. And half of the 1,100 tons of mercury that arrived in Bolivia between 2014 and 2022 come from Mexico, exported by Mexican businessmen with Peruvian intermediaries in small and medium-sized containers. The Amazon regions of Peru and Bolivia are the main producers of gold, and he goes on and on with more data, saying these businesses in our region are super hard to follow because Pandora Papers, there's a scandal of paradises, fiscal paradises and everything. And so we now have in the region a very intermingled situation between narco traffic, warlords, mining, illegal mining, extractivism, territories devastated by violence. We have beheaded people every day in Ecuador, all day in the main cities. So my question is, how long do you think it would take to arrive to the indigenous communities in Brazil? And this is much more huge problem because little countries like mine or Latin America is not gonna solve narco warlord drugs. We need to stop consumption or legalize it or something, but it's not thing that we can do without a global effort.
So you're saying how long it's going to take for this violence to arrive?
Yes.
It's there already.
With narco warlords?
Yes.
So Lula is not going to be able to
No. We got to be optimists. Remember the previous session. So, right? Yeah, I am. So there is one area in the westernmost part of the Amazon. That's where I do field work on malaria. Now it's in the route of the drugs. And we had to change the entire way we work because they just call us and say, leave. And then we have to leave. So, but again, how did that happen? So I'll just give you one example, and those are the things we have to reverse. The previous president made it very easy to buy a gun. And in this country, we know what that happens, right? So the increase in gun ownership was like 4,000%. It's ridiculous. So the first time I went to the Amazon was 99. It's a very different Amazon now because people are armed. Now, how we're going to fix this? To me, that is one of the big challenges because people are just killing. And I don't know exactly how this is going to happen. It's going to take time, but that's the big change we had from when they implemented that plan back in 2004 and now. It's the region is armed. So.
Hi, I'm Karina Weinstein. I work for FXB and I work with Youth Climate Advocates, but I'm actually here as a parent who feels really failed by the health system and health professionals. And you know, there was a panel earlier about climate change being personal. Well, infectious disease and Lyme disease is so personal to me. When about 7 years ago, my 5-year-old contracted Lyme meningitis, between onset of symptoms to diagnosis, we saw multiple health professionals, emergency room, neurologists, multiple pediatricians. No one suggested to include Lyme in his blood work. No one knew what that was. It was just by mere whim that we did the blood work. And I asked the pediatrician, he didn't suggest it, to check for Lyme. And then, you know, he was treated, which a 5-year-old being treated for Lyme meningitis was like so complicated. And I'm still traumatized. But now 7 years later, what I reflect on is that the system failed me. Like as a parent, I had to navigate. How is it possible well, now that I know with all this research emerging around infectious disease and increase in prevalence of Lyme as a result of climate change, how is it possible that no one guided me, that that wasn't 3 weeks of debilitating neurological symptoms to finally sit, God bless that pediatric infectious disease mammonitis who looked at my son and in 5 minutes said, he has Lyme meningitis. It's so obvious. But for 3 weeks before, I mean, you can only imagine as a parent. Fast forward to now, I have another child, his younger brother, who has severe allergies and asthma. Again, the multiple health professionals that we see, the endless pulmonologists, allergy immunologists, pediatrician visits, and no one helps me plan for these like expanded allergy seasons. We're not talking, you know, a few weeks a year. Now we're talking endless allergy seasons. The nurse calling me, this child, you know, swollen and, you know, in times of the year when you least expect it and, you know, much longer. It's so, I don't know, I guess what I keep reflecting on now that I work in this space and follow the research is what can we do to strengthen the health system, the training of health professionals, because ultimately, you know, I feel like I'm being failed as a parent, or I don't have the partners that I need to help manage my children's health, and I'm always just like a few steps behind or just really frustrated and really tired. Thank you, Dr. Bernstein, I guess, but anyone else?
I think actually, yes, but I just want to, maybe you could reflect on both that incredible frustration and pain that the patient side feels in terms of navigating the changing landscape, but also what it's like to be a provider in a world where actually the tapestry is also changing.
So first of all, thank you for speaking up. I wish I could say you're the first parent whom I've heard with very similar sentiments about the enormous disappointment of dealing with medical providers who simply just aren't aware of what's going on and how children are left behind. And so I think the more parents like you are vocal about that, the more it agitates for people like me and people in this room and people in this audience to realize that we actually do need to do better, that the status quo is not okay, and that the profession of medicine actually does need to be accountable to climate change. which I think we can be pretty optimistic that that's happening. I'm very proud to say that our center was the first in the world, founded in 1996 at Harvard Medical School, at a time when people saw climate change as a problem for polar bears and nothing to do with people. And so over the ensuing, quarter century, we can now say that in the Harvard Medical School curriculum, every Harvard Medical student that graduates Harvard Medical School is going to have to confront this. But it's not just Harvard Medical School. There's a huge trajectory nationally. Our School of Public Health, we are working on an integrated curriculum so that every student at the Chance School will learn about these things, so that parents like you are not wondering why their pediatrician doesn't realize that the kid's cold in March is not a cold, that in fact it is allergies, or the child who, it's not just Lyme disease. We have a whole suite of tick-borne diseases. We have fungal diseases, coccidiomycosis, valley fever from the Valley of California. I'm looking at Kari, who is practicing this. It's showing up in the upper Midwest. It showed up in Boston. And so this changing tapestry is very real, and sometimes it takes some parents with a little bit of motivation to help, people are very happy saying we're okay, to realize that we need to change. But I want to emphasize that having been at this for a while, and again, I would give full credit to the medical students. I don't think this would have happened had it not been, they organized nationally on this. There are students at most of the medical schools in this country, students at schools of public health, including our school, have organized on this and pushed us to embrace the reality that you've seen.
Okay, this guy has had questions every session, and he always gets cut off.
He's an alum
Josh,
of our
sorry.
school.
Okay,
He's an alum of
nice.
our school.
Yes. Okay, Caroline.
I just wanted to add to this. So there's also a fundamental problem here where things that with infectious diseases that are rare, that may not be rare in the future, and especially in the context of emerging pandemics in, sometimes in low and middle income countries where we may not be familiar with the biology and transmission of pathogens that emerge, and we will need to be ready. So there's going to be a shift in what's rare everywhere that we will need to learn about. But right now, there's CEPI, which is trying to make vaccines against some pandemic-prone but now rare infectious diseases. But the funding models have to change also for research to reflect pathogens that have pandemic potential and are important already in parts of the global south, but have not yet become common enough here for people to be well-versed in them. And so I think, again, we have to shift our whole mindset about what it means to be rare, what might be rare now but will not be rare in the future, and have a much more adaptive system of research funding allocation and focus, frankly, when it comes to pandemic preparedness as well.
And data. Yeah. Oh, yeah, we do. Josh. I know. I just was mindful that he got cut off last time, so.
Yes. Thank you. So I'm an alum of the school. I now work on these issues in the federal government. And I'm wondering if you all could talk about how you walk the boundary between these issues aren't so simple, they are complex, but not so complex that we just throw up our hands and give up.
Caroline.
I do think that some fields are due for a major reckoning. And I think that for those of us in infectious disease, I think we all need to think very seriously about the research, what the important research priorities are, and how we can stop paying lip service to saying the word interdisciplinary and actually doing interdisciplinary work. And I don't just mean, oh, I collaborated with a physicist, so it counts. I mean, like, cross-university, cross-country, real collaborative conversations. At the moment, one of the things that's hard is that we're all scrambling for time. It's very hard to have long, deep, thoughtful conversations and read the scientific literature across fields and speak each other's languages. I think we have to really prioritize truly multidisciplinary research, because when you do, I think extraordinary things can happen, and we start seeing innovation flourish. But we can't do it without really re-examining research priorities and our abilities to break down silos, because universities kind of create silos by mistake over time, and we need to find real ways to come together on some of those issues.
Actually, oh, sorry.
A very quick answer, Josh. We can't give up because we don't have another planet to live. It's everyone's responsibilities here. So it's challenging, it's frustrating, but we got to keep moving.
I also think there is some low-hanging fruit. There are some really basic things we just need to go out and measure well and start doing the work.
Well, and a lot of room for innovation, right? Actually, just in thinking of the infectious disease diagnostic question, actually new technologies, AI is going to be our friend in terms of thinking about how to practice medicine adaptively.
Right,
and so there's a lot of room for really radically rethinking how we do business.
Yeah, we have now like paper-based, multiplexed assays, so you can tell more than one disease on a, and it's heat stable, and you can get it out into different places. There's a ton of things happening. It's just about translation, I think.
Okay, Kari, I feel like there is a person standing behind you. You should have the last word anyway, so you go.
Hi, my name is Anna Makritz. I work as a public health epidemiologist, and I want to speak to 2 points that you raised earlier. Speaking to Caroline in particular, but curious to hear anyone's thoughts about data and thinking about some of the gaps that you identified in our current data systems. So one, thinking about, as you said, the need for data on the environmental side and then the human health side to be combined in a way that can be usable and operationalized. So I'm wondering, at what level you foresee that being able to have the greatest effect, and what feasibly, given our politicalized, often public health system in our country, where that can happen most effectively, if that needs to happen at the state level, at the federal level, more locally. That's one question. And then another question was thinking about, you mentioned having the need for data to be driven not only by the sort of global or sort of predominant priorities, but by local priorities. And I'm wondering there whether, or if you could describe some examples of places where maybe qualitative research has helped to inform the way that data systems are collected. And then sort of again with that and thinking about the silos in which we work, whether it be like the academic public silos or within either of those 2 spheres, how you see opportunities for bridging those silos through this type of restructuring of how we collect data.
Okay, I'll try. As far as, well, actually, parts of your questions are, I think, together. So I think the local prioritization is also the data prioritization. And so I think partly because the spatial and temporal scales of the climate world and the health systems world are slightly different in a lot of places, it's hard to bring data sets together quite often. So I think we need more granular data. And I really, during the pandemic, I think what we saw a lot of was the collection of surveillance data for the sake of collecting surveillance data, as opposed to collecting data in order to make a decision differently. And so what I would like to see is local prioritization that is actionable. So I think in this country, I'm not an expert in the US health system, but I think my experience during COVID suggested that state level and even more local collection of data that could drive decision-making at that scale is something that would be really great. Because quite often, and this happens in many countries where I work, the environmental data available is available on huge spatial scales, or it's from climate models, and the resolution of the data isn't fine enough in order to be able to link it meaningfully with health data. And so creating those mechanistic, as it were, links between some of the variables that we have in climate models in larger scale and health systems and your actual patient data is going to be very important. So, and then what was the second part?
So thinking about like qualitative data.
Oh, right. Yeah. So about halfway through the first year of the pandemic, I think I wrote a paper about how important human behavior was in models getting it wrong. I think there has been a certain arrogance in academia in general that places quantitative methods above qualitative methods somehow. So we had a lot of people making SIR models because they knew math, with no sense of local context and the impact of social contact patterns and the importance of human behavior and trust and all of those things, or the nature of epidemiological data and how it's collected. So I think we need to be much more systematic about bringing qualitative data into our modeling frameworks and into the way that we think about infectious disease epi data in general. The ways to do that, I mean, again, I think it's partly a mindset of making sure that you have collaborative teams that come from different aspects of the problem. And I think we need to readjust our biases and recognize how key local context is to informing some of our methods. And a lot of that is qualitative data and local expertise. So it's essential. It's not always easy to do. I think it's easier to publish papers that don't do that than it is to actually do translational science that has to take that into account. But it's a very important goal.
So thank you. And then Kari, you get to close us out here.
Well, first of all, thank you so much. And we're looking forward to our next keynote speaker at 5 p.m. Or around there. But I wanted to really leave this discussion with kind of a catalytic ask. And I know, Sarah, you had mentioned that you'd like perhaps these questions to be more general, because we've seen throughout the day sessions that discuss heat stress, sessions that discuss environmental justice, sessions that discuss how the government can play a role in working with us. But now I want to get back to we as public health officials and public health researchers, and also individual health practitioners. With that in mind, as you think about the future and you think about what we've done now in public health and what we do, measure, manage, monitor, we quantify, we qualify, and then we implement, and then we practice public health. The issues around climate change are so centered around planetary health and public health. How can we do better? How can we innovate? Because in any one child's lifetime now, they will suffer through at least one climate change event. How can we do better at modeling for any one point in time environmental exposures? And being in environmental health, this is really important to me and our group as to how we can serve the public health community better. Because any one individual is not just getting an infectious disease exposure, they're getting wildfire smoke exposure, they're getting heat stress exposure, they're getting vitamin A decreases because of the food that they eat has been heat stress. So with all of that, how can we best be innovative in terms of multiplicative modeling of multiple exposures at any one point in time, but also longitudinally over someone's lifetime? That to me is part of what, Caroline, you're saying with data, obtaining that and making sure that we can use it effectively, but let's lead the way as public health practitioners and public health researchers to be able to move that forward, because I think it's going to help our policymakers. But do you think that's possible today? And if not, how do we get there?
Can I just say, I'm mindful that it is 5 o'clock, and that feels like a call to arms more than a question. Did you want to pose that as a question, or do you want to pose that as a challenge to us as we move
I think
forward?
it is both, absolutely.
Okay, if it's a question, then Caroline, you get the, well, it's 5:05, so you get the sort of how synthetic data modeling wizard.
Honestly, I think it's a mindset, and we have to, we have to come together as a public health research community and be very serious about it, and not, there are always academic pressures that we all face all the time, and we are all very busy people, and trying to get grants and so on. But I think this is a good moment for us to re-examine our priorities. All of us are here, and we're doing the work we do, presumably because we really care about this. And as Marcia says, like, there's nowhere else to go. This is our world. And so I think it's a mindset issue. We can do it now. We can go out and do a better job and measure differently and collaborate. And I think it's just an issue of will, mindset. Of course, funding has to be there to make it happen. But I think, this event and some of the developments around the school and the university suggest that people are starting to really come together and take it seriously. And I hope that I hope that we can.
So
very quickly, just one thing to add. I agree with everything you said, but I think this has to be done with the public health officials. So I work in malaria. I work with the folks on the National Malaria Control Program in Brazil for almost 15 years now. And, you know, I think compared to the US, Brazil has much better data. And now we are ready to move in a direction because we have alerts of deforestation and of opening of mining daily. We're ready to go into a predictive model that they can run every single week and take action and try to prevent new cases. But this takes time. That's what I was going to say. It has to be done with the public health officials, and it takes time to build trust. It's not going to work if you just do in our environment here, publish a paper in Science, yay, but it's not going to change anything, nothing at all. Most likely it's going to be done with the wrong scale. It's annual. I'm sorry, there's seasonality within the year. So if you publish something annual, it can be great for science, but it's going to do nothing to reduce transmission. So it has to be done with them, listening to them, and there is a need for capacity building, because if they don't understand why this is important, not their fault, but it's not in their curriculum, it's not going to happen. So again, I think we have a role in raising awareness, training, being humble, training, but also listening and working with them, developing models that lead to the change, not just lead to a paper in Science. So that's what I
Or not even in Science.
Thank you.
So I would like to take this moment to thank our panelists. This was an awesome discussion. I consider this a real call to arms and inspirational. I hope you all did as well. And now it is my pleasure to turn it over to Kari, who's going to introduce our second keynote speaker.
Thank you so much to Dr. Sarah Fortune and our panelists for that very engaging discussion. We also appreciate everyone here being in the room, because it is my honor and pleasure to introduce our next keynote speaker, who has come from very far and has endured some recent issues to be able to be here today. So I just want to really applaud you for being here, and we really appreciate that. So thank you. It is well worth waiting for. I hope you see the book outside as well as see the book here. So it is my pleasure to be able to introduce the keynote speaker, Heather McTeer-Toney. She is the author of this book, Before the Streetlights Come On, Black America's Urgent Call for Climate Solutions. And it's outside, so I hope everyone will get a copy. Heather served as mayor of Greenville, Mississippi from 2004 to 2011. She was the town's first woman and first African-American mayor, and its youngest mayor elected at age 27. One of her defining initiatives as mayor was fighting for funding to clean up the tap water in Greenville. Heather has said that at first she didn't think of herself as an environmentalist, but over time she came to recognize that the issues she cared about most, water pollution, air pollution, community health, were all tied to environmental justice and climate change. In 2014, Heather was appointed by President Obama to serve as regional administrator for EPA. And she then went on to lead the Moms Clean Air Force Team, a powerful grassroots group fighting to protect children from the harms of air pollution. Heather now serves as Vice President for Community Engagement for the Environmental Defense Fund. She has trained advocates for climate justice around the world, and she's the author of this book. After her speech, I hope you will all join us for a reception upstairs in the Williams Room, and it's now my distinct honor to welcome Heather McTeer-Toney. Thank you.
Does this work? Okay. Well, hello, everybody. I had an absolutely amazing, beautiful speech prepared for today. I mean, I have been working on this and thinking about it and really thought I just had exactly what we were going to talk about. And that was until about 8 o'clock this morning. I arrived yesterday around 3, got situated, got in, going through my notes, and determined to enjoy the lovely Massachusetts food that I love so much. Something did not agree with me. And so I found myself this morning not only in a lot of pain, but trying to figure out how in the world I was going to get here this afternoon. And so through a few little war wounds, I'm here. But sometimes the universe, or if you are a person of faith like I am, God changes things around so that you understand the message that you're giving before you even get it. It's the lived experiences that people who are in environmental justice communities go through every single day in order to help us understand what the impact is of our work. So I thought it was quite phenomenal that I titled this No Matter What. And it ended up being Get There No Matter What. So I hope you don't mind if I take a seat. Because the place that I want to start is actually with the no matter what. And it comes from a story that I wrote in the book, and if it's okay with you, I'd like to read a part of it. Hopefully we will get to hear some of it directly from the person, Miss Sharon Levine, who I heard was going to be in town this week. A lot of people who will be here for climate work. But Miss Sharon is special. And if it's okay, I'm just going to read how special she is, and then we'll get a little bit deeper into why this is so important to talk about with respect to health and equity in communities of color and environmental justice communities. This comes from the chapter that I wrote, Chapter 4, Living Over the Soil and Under the Cloud of Contamination, Natural Gas, Petrochemical Pollution, and Climate Change. Some people could look at a mud puddle and see an ocean with ships. Zora Neale Hurston, their eyes were watching God. I was standing on the carport of Sharon Levine's home in St. James Parish, Louisiana in June of 2020 when I gained a whole new respect for the term resilient. Along with a few colleagues from Moms Clean Air Force, I made the trek from Mississippi down to Louisiana to speak at the Rise St. James Juneteenth event and put my feet and hands to work raising awareness about stopping the proposed Formosa plant from locating in the community. At the time, there was a glimmer of recovery across the country. The COVID-19 vaccine had been released and people were getting the shots. President Biden set a goal of having 70% of American adults vaccinated by July 4th, and my husband and I were fully compliant. Travel was beginning to spring back to life. Masks were required on planes and trains. Making it more exciting was the fact that Congress and the president signed legislation making Juneteenth a federally recognized holiday. It seemed right to celebrate the day that the last enslaved Africans got word of freedom by working to make sure their descendants were freed from the petrochemical pollution that encapsulated every aspect of their environment. I told Sharon I was on my way and ready to do whatever she needed done. Without missing a beat, Sharon led us to her carport that was filled with Rise St. James materials and handed us petitions, flyers, and signs. Go to the neighborhoods down the street and tell the people that in case of a hurricane, we're going to meet at Rose's Catering instead of the Formosa plant site. My mind said, we're still meeting in the middle of a hurricane? But my mouth knew better than to question it, let alone give it voice. Nothing, including the first named tropical storm of the 2021 season, Claudette, would stand in the way of ending historical environmental injustice in the community. Tropical Storm Claudette would have to wait because we had work to do and justice was impatient. I reached for the extra mask in my pocket and responded, yes, ma'am. Which street do you want us to hit first? Sharon's efforts have garnered international attention. She is the 2021 winner of the Goldman Environmental Prize for North America and has appeared in countless magazines and news articles. Her resilience is born from years of weathering storms, regardless of whether or not they are hurricanes, back-to-back floods, relentless layers of petrochemical pollution, or plain old Southern systemic racism. For years, communities on the front lines of pollution and climate change have survived through the sheer unwillingness to be deemed the sacrificial lamb for America's dependence on natural gas and fossil fuels. We've had no choice but to figure out ways to raise awareness of environmental injustice while addressing systemic racism, social justice, and developing the generational sustainability of the community. Sharon was doing what generations of our families have simply had to do: yell until someone listens. Communities across this country have been living in resilience as long as generations of people have been in this country and beyond. It's because it's what we have to do. And the interesting dynamic to me has always been that while we sit and we think through solutions and we are in the doom and gloom of climate change, there's plenty of climate doom and gloom out here if you haven't gone and heard just the latest news report. What is often missing is the climate hope and the climate solutions that are found in the communities that have raised us each and every day. The difference is they don't have the benefit of silo. So what does that mean? It means that in every single environmental justice community, they're also grappling with the issues of healthcare systems that are unfair, of police brutality, of education, of food disparity, of failing infrastructure, and how in the world are they supposed to stop and focus on one thing that we're focused on without addressing everything else? It is that mere fact of our failure to incorporate all aspects of the community when dealing with their health. I came in towards the end of the last presentation, and it was so good to hear the conversation about cumulative health impacts, because it is those cumulative health impacts that help us truly understand not only what is the current status of the community, but what is it going to take to get them to the place of not only climate resiliency, but also the future of those generations that are to come. And guess what? They know and have some semblance of what to do. Ms. Johnson, that lives on the corner of 3rd and Jackson Avenue, who has lived in the same house for 45 years, who has seen children raised on that corner, she can tell us better how the seasons have changed than any scientist could. She knows how when the roots go underneath the street and they crack up, when the city needs to come through and repave, because she's the one who calls them. She could tell you how many children in that community have asthma, and she can also tell you how many people have missed days from work because she keeps the kids. All of this is collective knowledge and information within the communities to which we serve and which those are hardest hit. But what are we not calculating? What are we missing in their quest to ensure that they survive absolutely no matter what? Because they have. It's one of the reasons why I really enjoyed writing from the perspective of an African-American woman in the South. I'm from Mississippi, born and raised. My parents came to Mississippi as a part of the voters' rights movement in the late 60s. My dad is a retired civil rights attorney. My mother is a retired school teacher. There was no shortage of justice and education in our household. But at the same time, there was an understanding that we all work together for the collective community. And in doing so, we have an obligation to ensure that we continue to exist. So, when you think about African Americans in this country, we are the embodiment of resiliency. We are a people who was taken from one ecosystem of plants, animals, germs, trees, air, land, and tragically and traumatically removed and brought across an ocean to a different ecosystem, different air, different plants, different weather. And then we were forced to labor from people from an entirely different continent and ecosystem. My God, resiliency runs through our blood. And through all of that, not only have we found ways to maintain our communities under some of the most treacherous circumstances, we teach others how to do it as well. My favorite story is that of the hope of women who were coming from the west coast of Africa, who had the forethought to tie rice seed into their hair. They braided it into their hair, not knowing where they were going or whether or not they would have an opportunity to plant, but just the mere seed of understanding that somewhere, at some point, in some time, I might be able to sow something that now nourishes me and my family in the same way that I have been raised. That's profound. And that same genetic forethought runs through us, because that's how North Carolina rice got to be so significant. And the Gullah Geechee people are still protective of that to this day. So it's in those systems that we now understand not only what it means to be resilient, what it really, really means. The authentic connection of people to culture, to land, to the protection of the environment, and here's one, how the environment protects us. Because so often we don't think about that. So many of our ancestors, both in the African American community and in the Native and indigenous communities across this country, the land has protected them in the same way that they have protected the land. That's evident in the many songs that come from the African American traditions of how they use nature to escape their confinement. How rivers and trees were part of the system of freedom. So it's not far from us. It's ingrained into a part of our being. But these are also the very same networks that systems use to try to continue to encapsulate us. And without the real understanding and conversation from people who come from these lived experience, there then becomes a barrier and a divide. That divide shows up when we go into communities and we want to plant trees, and we cannot figure out for the life of us why people in communities of color may not want to come out and plant trees, but we fail to take into account that sometimes generations of their own ancestors hung from the very same trees that we are trying to plant. And so connecting to the culture and connecting to the people and understanding the different varieties of what and how and who we are trying to be and become must be done in one space, cannot be done apart, because they don't operate in silos. We don't operate in silos. We must learn to operate together, and to take the information that we have garnered from our research, from the beauty of diversity that has now sprouted across this country in academic institutions everywhere, having students bring their lived experience of where they are coming from and what they know into the calculation of the data. Now we are getting somewhere. That is the space where we are ultimately understanding not only climate solutions and their impacts to us, but what we need to prevent. I've recently taken on a new role as the executive director of Beyond Petrochemicals, which is an initiative of the Bloomberg Philanthropies. And in this, we are looking to stop the expansion of petrochemical facilities across this country. 120 proposed petrochemical facilities that sit in the very same footprint that plantations sat on in Louisiana. Think about that. And the expansion of these polluting entities, it's not because we need some more plastic. Seriously, how many of you do not know what spaghetti looks like? Raise your hand. That's what I thought. And you'd be ashamed to raise your hand because nobody wants their mama to know that you don't know what spaghetti looks like. So why is it you need the little plastic window on the front of the spaghetti box to tell you what spaghetti looks like? You don't. There is unnecessary pollution in our communities that we've been fooled into thinking is necessary because we've been fooled into thinking it is jobs, it is opportunities. But is it really? Is it really a job when you have to turn around and spend all of the extra income that you might have gotten on going to pay a medical bill? Is it really a job when the food costs have increased because of the petrochemicals that are now in fertilizer, and now you're having to pay the healthcare costs? Is it really a job? Is it really a job when they go to recruit people from outside of the community versus the people who are living right then and there? All of these are the things that happen when we silo the conversation. I want to begin to close. I am from the traditional Baptist, Black Baptist tradition, so we close 3 times. So I'm going to begin to close with something that is very real and something very prevalent, and another section of the book that I'm going to read for you. And this was the most difficult part of the book for me to write. And I hope you understand why. This comes from chapter 9. Climate crisis is an accomplice to the murder of George Floyd, links between climate change, extreme weather, and violence. On a warm September night in 2020, I was driving to my office, ready to pour onto paper the thoughts that had gathered throughout the day about climate. During the day, I'm focused on my job at the Environmental Defense Fund. At night, when I can pull away with a little time, I write. On this particular night, I was driving home, deep in thought about Hurricane Sally striking the coast of Alabama and Mississippi. This was the second hurricane to strike the Gulf Coast in less than a month, and my mind quickly filled with words I planned to write on storm devastation and the invisible yet lingering impacts of air pollution and floodwaters. I brought in ideas that intrigued me from a series of articles that connected global warming to weather-related disasters to an increase in violence. I was determined to avoid all distraction, no matter what, to get these thoughts on paper. Up ahead on the road, I saw blue flashing lights. 2 police cars were behind the late model Nissan Altima. As I slowed my car to pass, my heartbeat sped up. Although it was dark, my headlights shined upon 2 young Black men who looked like college kids. School at the University of Mississippi had recently started back with the limited in-person classes, and these young men were wearing the classic Ole Miss uniform of khaki pants and a polo-style shirt. They sat on the hood of one of the police cars, heads down, while one officer with a flashlight looked at paperwork and the other looked through their car. I took a deep breath. I'm the mother of 2 Black sons, one who has had his own experience with the police. It had been less than 6 months since the murder of George Floyd. My husband's oldest son, my bonus child, was living in Brunswick, Georgia, when Ahmaud Arbery was shot and killed by 2 white men. The hashtag, I will stay with your son, had been trending on Facebook. Mothers of all backgrounds from across the country were taking a pledge to stop when they see young Black men stopped by the police. The charge is simple. Take no action, just stay. Just be the presence, be the mother. Be what you want someone else to be for your son. Before I knew it, I'd pulled into the exit ramp to loop around and dialed my husband. Babe, I'm on Highway 6 and the police have 2 young Black men pulled over sitting on the side of the road. I gotta turn around. My husband responded with alarm. Where are you? What highway? What's happening? I told him my exact location, and he could hear in my voice my determined concern. I could hear the fear in his. I knew that there was a chance I might get a ticket, or worse yet, be harmed for trying to help. I also knew that violent interactions are more likely to take place when it's hot. When I saw those 2 boys, I could not help but see my own 2 sons. The deafening collision of movements that I experienced that night reminded me of a stark reality. Regardless of whether it is climate change or police brutality, there is no social justice issue that does not intersect for Black Americans. That rung so true to me over this weekend after hearing about the shooting in Allen, Texas, where at the beginning of my book, I talk about friends of mine, Tyra and Eric and Valerie, that I grew up with, who now live in Allen, Texas. And I watched with alarm as they were just recounting where they were and that they were safe. And it also alarms me that as people go after immigrants in hate crimes, these are often people who are escaping climate violence in their own communities. This is only going to get worse. We are only going to have more and more people who are seeking asylum in our country and other countries because of the climate disaster. And they have made up in their minds that no matter what, they are going to live. So this idea of what resiliency is, it is more than us just understanding that there are infrastructure pieces to put in place, that there are data numbers that we need to collect, that there are health impacts that we need to consider, because we have to consider all of this while people are moving now. People are taking action now. It is not a question as to whether or not the climate is changing or whether or not health is being impacted, because they are living and breathing it every day. We do not have to go far to understand whether or not cancer is being increased because of facilities. We just look at the death records and what people are putting down as the cause of death. We don't have to go far. What we do have to do is connect the dots and ensure that we are getting the full story from people and that we are incorporating their full solution to us. It goes back to what Ms. Sharon was doing. When Ms. Sharon was fighting the Formosa plant, through hurricane, through a new storm that had come in, because I talked to her again and we were talking while she was sitting underneath the carport waiting for a roofer to come, because she needed a blue tarp over her roof. And she said to me, "Heather, I need a generator." "Okay. You need a generator?" She said, "Yeah, I need a generator so I can plug in and I can go and put on Facebook Live what these chemical companies are doing. Because, see, nobody's looking right now because there's no power and they're doing all this flaring out here. So I'm going to go take my phone and I'm going to tape them. And then I'm going to put it on Facebook Live so everybody can see this is what they're really doing. I need a generator for that. Not for power for the house." And I hope that you get to meet not only her, but so many other activists who are in this country right now doing the Lord's work on the ground. Because they're not waiting. They're acting. And they're acting no matter what. And I think it's high time that we join them in this fight with our resources and our determination and our will. Thank you.
Thank you so much. This is an incredible conclusion to an amazing day. And I just want to thank you, Heather, and for the time you've taken with us today to give us those inspiring messages and to take your call very seriously, that we must learn to operate together to be able to prevent and to solve climate change. And in that, if past is prologue, I truly believe that we can do that through public health, education, research, and practice. And I want to engage all of you to be able to join me and others to be able to accomplish that together, Heather, because we are inspired by you. Thank you. I also want to thank Dean Williams, the speakers, Stephanie Simon, our communications team, all of her team, also the moderators for this incredibly engaging day. And I want to thank you, those of you in the audience, for your participation as well. And if you haven't been able to ask all your questions. I hope you will do so after the session, and to join me in the Williams Room, which is upstairs, to be able to have further cocktails and discussions. And we really appreciate this being the first day of the Salata Institute series of days. Tomorrow, there will also be another chance to engage with us in a breakout session for heat stress with many of our faculty and community. So again, thank you so much for your participation today. It's been a joy to be here and to work among you, and I look forward to engaging further. Thank you.